Good morning, colleagues and dear friends. Sabah al-Khair, Salam alaikum. We will start in like a couple of minutes, so please be patient until people will all log in, and then we will start, so 2 minutes sharp. Good morning. Good morning, dear colleagues and friends. Sabah al-Khair, Salam alaikum. We are now about to start our second webinar on school reopening in the Arab and MENA countries. And this is a big chance for us to delve more in depth into this very hot issue of back to school and how to cater for quality learning following the COVID-19 crisis. I'm Dagmara Georgescu from UNESCO office in Beirut. I'm the main host of the webinar with my colleague Eli Imad, who's assisting us from a technical point of view. I have first some rules to announce for everybody to please follow, and then I will hand over to our colleague from UNICEF Menaro office, Mrs. Jeannette Fogelard, to facilitate the first session. As you may remember, on 20 May, we ran a first webinar on school reopening, and that was a shorter webinar and only in English. Now, this time the webinar is longer. It's almost 4 hours with a break of 15 minutes, during which we hope you can relax a little bit. And we then hope that your span of attention will be preserved for the second part. So we start now around 11, and the webinar will run until around 2:45 p.m. Beirut and Amman time. Participants can use this time 2 languages, so English and Arabic. Please, thus, you have on your screen the interpretation box, and please go and select your language first, so the language you want to listen to. And you have 2 possibilities, either English, or for the Arabic speakers, please select French. So the French channel stays for Arabic translation, Arabic interpretation. And then the second step, please mute the original track. So if you don't want to listen to the other language as well, then mute the original track. Please, all the participants, address your welcoming messages in the chat section. And for the question and answer part, leave only your questions or comments and answers. Participants are being muted during the webinar, because otherwise it would be too difficult to manage. But everybody can address in writing, either in English or in Arabic, their questions and comments. And our facilitators will take care that all will be taken back to the panelists or to the organizing team. And those questions we cannot answer immediately will be considered for later responses after the webinar. We will not use the hand raising function, basically, because we have many participants and more than 400 registered so far. So we expect a high attendance. So it will be difficult to then look for the person to be unmuted. But if you have some burning issue to communicate, please still raise your hand, and then we'll try to give you the chance to also talk during the question and answer session. About the time, the presenters have been asked to not exceed 10 minutes each. At the end of these 10 minutes, although we hope not to use this function, we want to launch a sweet chime, you know, this melody, final countdown. So you will hear the final countdown signal. That means that the 10 minutes are over, but we hope not to use it. And then finally, we kindly ask the speakers to stick to their language, because otherwise it's going to be very difficult for the interpreters to switch from one language to the other. And finally, I think also for the speakers, try to slow down, because we need proficient interpretation, and if you talk too quickly, that's going to be difficult for the interpreters. As said, there will be a break at 12:45, during which we will broadcast some music, some relaxing music, so that you can relax a little bit. And then we will try to come back around 1 o'clock, 1:05 sharp, so that we can have the second part. What do we expect from this webinar? First, we want again to see what's the situation in our Arab states, the MENA region, about school reopening and all the back to school process. Where do we stand? What are the concerns? What are the challenges? But also what are some possible solutions? There will be basically three main sessions, three chunks of presentations followed up by question and answers. The first session is of an introductory nature. We will have two presentations from our headquarter colleagues and from WHO. And then there will be a session for the Arab countries to present their different strategies, scenarios with regard to back to school and their concerns, and also different policy issues that they have to consider. And then the third, the last session after the break will be devoted to presenting different topics related to back to school, either the learner perspectives on distance learning and what do we learn from this COVID crisis to improve our policies and practice, or the issue of psychosocial support and social emotional learning, or how do we really operationalize this international framework for school reopening that we all know now and that had been launched actually last April. So without any other ado, I will hand over to my colleague from UNICEF Menaro office, Mrs. Jeannette Foguelar. Adriana, she has two names, so this is a little bit confusing for people. So Jeannette Adriana, and she will facilitate with her colleague Hind Omer this first inaugural session. So thank you, and Jeannette, over to you.
Thank you very much, Dagmara, for this introduction and get us started. As Dagmara already mentioned, this is the second seminar. The first one took place on the 20th of May, and at a time when the schools in the region and ministers of education were all closed, most of them closed, and students, parents, teachers, all of us, we're trying to get used to the new reality, which required a drastic change in how we were used to deliver education. So in that seminar, we heard from Egypt, from Lebanon, from the United Arab Emirates, from Morocco, as well as from UNRWA, about their innovative work to ensure that children, despite all this challenge, engaged in learning, even during the lockdown. There were participants from 13 countries in the region, and also their national and international regional partners that complemented the speakers with their experience as well as the challenge they faced. And it was noticed that despite all the great efforts that were made by governments in the region to ensure alternative options, the impacts may not have been as optimal as we wished for. Online platforms were not always reaching all children, and sometimes even if they were reaching those children, they may have had some challenges to remain actively engaged. So during the seminar, we also presented the global framework for reopening schools that was supported by the international organizations that are organizing this webinar: UNESCO, UNHCR, World Food Programme, World Bank, UNRWA, and UNICEF, and advocating for the importance of ensuring that schools, when reopening, are safe places with adequate conditions to apply protocols on how to operate, applying social distancing, good hand washing protocols, and also what to do in case new cases would appear in schools. The second point was around to make sure that children would have the opportunity to catch up on learning, as many of the children may not have had the engagement we would like to have them had to remain updated and with their classwork. And the third point, very important, was to ensure that when schools reopen, all children would come back, and particularly those at risk of dropping out, particularly as a consequence of the economic impact COVID had on the economies at country level. And lastly, but not least, to address the psycho-emotional impact of children when reestablishing learning to take place, to make sure that also we pay attention to re-establishing regular and safe delivering of essential services which they may have lost out on, for example, school feeding, protection referrals, or other special services addressing children with disabilities. Now, 1.5 years later, COVID is still with us, and countries are slowly opening up. So while the school year 2019-2020 has ended in most of the countries, the discussions about how to reopen the next school year are intensifying. And it goes with a lot of challenges and a lot of unknowns. In this second webinar, we try to address or discuss these challenges in more deep depth. We will hear from other countries and organizations how they plan to deal with those challenges. And we hope jointly to come up with some concrete recommendations and possible solutions to take forward while preparing for opening the next school years, to ensure that all children come back, are safe, and have the opportunity to re-engage in learning. In this first session, we will hear from two presenters. The first one is Mr. Guang Shang from UNESCO HQ headquarters, who will present an overview of the recent global survey that was conducted by UNESCO, World Bank, and UNICEF with regards to government's plans to reopen up schools. And this presentation will be followed by a presentation from Ms. Dalia Samuri from the World Health Organization Regional Office, and she will reflect on what we know about the virus and how it can affect children, and elaborate on some of the consideration we could take into consideration when reopening schools safely. And then we open up for questions and answers. Please put them in the Q&A box and not use the chat for that, to facilitate responding to that. We have 40 minutes for this session. So over the two speakers, I hope they can keep the presentation to 10 minutes or 15-minute maximum to maximize time for discussion. So over to the first presenter, Mr. Guang Shang from UNICEF. Sorry, from UNESCO.
Thank you, Triana or Jeanette, and also taking me into UNICEF. Okay, good morning, good afternoon. I'd like to see if I can share my screen. Just wondering if we can see it. Can you see this?
Yes.
Okay,
yes.
so good morning, good afternoon again. This is indeed my pleasure to address this webinar on a very important topic, school reopening in many countries. So as introduced, UNESCO has been monitoring national responses to COVID-19 since its outbreak, including a series of surveys. This presentation focuses on national measures being taken to prepare for school reopening globally, and more particularly in Arab states, according to the responses to related questions of a most recent survey jointly conducted by UNESCO, UNICEF, and the World Bank. As measures strategic to contain the spread of the COVID-19, most, if not all, countries have taken measures to cancel their institutions. UNESCO started monitoring school closure worldwide since 16th of February, when there was only one country that closed schools nationwide. By 5th of April, 194 countries closed their education institutions nationwide, affecting more than 1.5 billion learners worldwide. Each corresponds to 90% of all learners. Since then, countries started reopening schools gradually by region where sanitary situations have improved, or in a phased manner by grade or age group. Today, 8th of July, close to 90 countries have reopened their education institutions, either locally or nationwide, leaving yet another 110 countries with the school closed nationwide, or 60% of world, learners worldwide. So as I said earlier, UNESCO has been monitoring national response to COVID-19 since its outbreak. The most recent survey conducted by UNESCO together with UNICEF and World Bank in June with responses from 118 countries, including 13 countries from the Arab region. This slide, I'll present some slides. This and following slides show some preliminary results on aspects related to pedagogical continuity when school reopen. And globally, by early June, around 6% of countries were already reopened. We know that by today, schools are open in more countries. Another 46 percent of countries at that time were planning to reopen schools nationwide, while 24% were planning to reopen schools gradually by region, or 20% planning to reopen in a phased manner by grade or by age group, meaning virtually all countries had a plan to reopen their education institutions in one way or another. More when it comes to Arab states, out of 13 countries that responded to the survey, around 50% of countries were planning to reopen schools nationwide. And an interesting aspect is that countries were planning to reopen in priority in pre-primary institutions gradually, almost 40%. Then other levels of education in geographical areas where sanitary situations permit. Which levels of education are privileged for reopening of schools in a phased manner by grade or age group? There seems to be no distinctive priority in the region. So the next slide is about to compare to compare the region, the global trends with Arab states regional plans in terms of government measures to address the learning loss and to ensure curriculum transition when schools will reopen. So globally, the majority of countries, around 67%, were adjusting the school calendar, which is a similar trend in Arab state region, with more than 70% of the Arab states were planning to adjust the school calendar. Furthermore, most Arab states were planning to adjust curriculum content when schools reopen, 77%, which is far more than global average of 61%. And another aspect, many countries in the Arab region were planning to introduce remedial learning programs. 9 countries out of 13 responding countries, or accelerated learning programs. Furthermore, 7 out of 13 countries surveyed anticipate recruiting more teachers, new teachers, when schools reopen. So this the next slide is about how countries are taking different options for managing high stakes exams across levels of education. So globally, postponement or rescheduling was the most frequent choices by countries for high stake exams for all levels of education. And where exams dates were maintained as planned, necessary measures such as physical distancing of students, staggered exams were also taken. And another aspect is that secondary education globally is the level where exam date were kept the most. Staggered exams were chosen in some countries, and the curriculum content to be assessed was reduced in many countries. This confirms also that exams at this level of secondary education bear the highest stakes among the levels of education. And this is also at this level that the adaptation is made the most for managing high-stake exams as compared to with the secondary education level. Few number of countries have maintained the exam state, such as at primary and tertiary level. The exams were cancelled the most at the primary level, with limited cases of online exams at this level. At the tertiary level, higher education level, examination systems organize online exams more than in other education levels. So I'd like also to go quick. I think I'm taking more time. Okay, this is in Arab countries. Similarly, many countries have postponed in Arab region or rescheduled the dates of the exams. An interesting aspect in Arab state region, distinctive to other regions, is that there is a greater proportion of education systems that maintained exams as planned. This was what we see from the responses of countries early June. It says that almost 40% in secondary, they have maintained the exams as planned. And this is more than in other regions. Countries mandate exams by addressing the following measures: administering online examinations, reducing curriculum content to be assessed, ensuring distancing, social distancing of students, or introducing alternative assessment or validation of learning. Two other distinctive features in the Arab region as compared to other regions are that first, no country has canceled exams at any levels. This is as it done early June. Second, reducing curriculum content to be assessed is more popular measure than in other regions. So this is what we find in Arab regions. So globally, this slide contains some information complementary, some qualitative information countries have provided in their responses to the survey questionnaires, and on some key challenges and policy measures they have taken to address them. Some key challenges for countries to COVID-19, in particular, those that may affect high tech and other aspects may include inaccessibility of traditional and online learning shared by different countries like Albania, Cuba, Indonesia, Maldives, Oman, the region, and Suriname and the UAE. And second is unpreparedness for education in emergency. And another aspect is the limited teacher capacity, especially when it comes to ICT skills, and also lack of health and safety measures in countries. And this is as reported by countries in their open education questions. And policy measures taken as relatedly were like improving access to remote learning through better ICT infrastructure and availability of devices. I think yeah, we have examples of countries here in the region, for instance, Oman, UAE, in Arab region, and also adapting curricula and assessment for distance learning, and strengthening also capacity for crisis sensitive planning and implementing health and safety measures. These are the some findings that we found, and so I'd like to before finishing my presentation, provide 2 more slides to highlight a couple of initiatives that UNESCO has taken to support countries in ensuring continuity of learning and in also facilitating curriculum transition during and in the aftermath of the COVID-19 pandemic. The first is the Global Education Coalition launched late March this year, as you might know, to bring together international organizations, civil society, and organizations and private sector partners to help countries in mobilizing and implementing innovative and context-specific and appropriate solutions to provide education leveraging high-tech, low-tech, no-tech approaches, and also to seek equitable solutions and universal access, and ensuring coordinated responses and avoid overlapping efforts, and facilitate the return of students to school when they reopen to an upsurge in dropout rates. So the joint seminar that we are organizing, like this one, is one of the best illustration how we are all working together during this difficult period. Another example that I'd like to give quickly is the
1
toolkit
minute, sorry,
development
Kwang, 1 minute, okay?
regarding UNESCO Mackenzie collaboration. I think you do see there it contains 9 chapters. So this I think this PowerPoint will be shared with you, so you can see here. I provide web link and you can click and to find out more about what we are doing, collaborating across all partners. Thank you very much for your attention. And if you do have any more questions, I would be very happy in the Q&A session. Thank you. Back to you, Janet.
Thank you very much. We will share the PowerPoints afterwards, and we also will get them translated into Arabic. Over now to Ms. Dalia Samouri from the World Health Organization. Over to you.
Hey, good morning. Can you hear me?
Yes, very well. Thank you.
Very good. Thank you so much. Just waiting for, yes. Thank you so much, Takmara, for putting the slides. So let me start by introducing myself. My name is Dr. Dalia Samouri, and I work as a manager for emergency preparedness and international health regulations in the WHO Regional Office for the Eastern Mediterranean. Next slide, please. So this is a little bit of information that I'm sure everybody knows about it. Coronavirus is basically it's an infectious disease that's caused by the most commonly, the recent coronavirus that has been discovered in China back in December 2019. And so far we have almost all the countries in the whole world have been reporting cases. More or less, we have around 11 million of cases and around 502,000 deaths. If we talk about the Eastern Mediterranean region, all the countries in our region have already reported cases, starting back in January, where the United Arab Emirates was the first case, for the first country to report cases at that time. But so far, we have the mostly occurring cases in the listed countries in front of you: Iran, Pakistan, Saudi Arabia, Qatar, Egypt, Iraq, and the rest of the countries as well. But also I would like to highlight that in the emergency countries, or the countries that are going under emergency situation, we know very well that the capacity for early detection or reporting or even confirming cases is pretty much limited. And therefore, maybe the cases that are being reported are somehow an underestimation in place. Next, please. So far, we know this is what we know so far about the virus. And again, I don't want to go in details when it comes to this, but the virus has been transmitted to human from an intermediate source, that we're still looking into this intermediate source. But again, although the cases were reported, or the first case cluster of cases were reported to WHO end of December, but at the moment, and as the research component is picking up very quickly, we also have received reports of cases occurring in different countries in the world, back even in November or maybe in October. The market could have been the origin of the virus back in China. And this might have contributed to the initial spread of this infection. If we move next, this is next. Yes, this is the most commonly occurring symptoms that have been reported from the different countries. So fever is basically taken the highest proportion, if you want, 88%, followed by cough, fatigue, etc. But at the same time, we are also collecting information from different countries about new, let's say, new discovered symptoms that might be associated with the infection, and this is basically related to the loss of smell or loss of taste, red eyes, and rash. If you move to the next slide, this is just to let you know what is at the moment the information that we have when it comes to the source of the transmission, not the source, actually the transmission of the infection. And the confirmed information that we have at the moment is that human-to-human transmission, a person, or when the infected person is coughing or sneezing, which means that when this person is producing or spreading some droplets, and any person in front of this infected person can take this infection. But at the same time, when a person is coughing or sneezing, the infected droplets can basically drop on surfaces, and therefore the contaminated surfaces might be a way of. There is some information at the moment that I'm sure everybody is following the news, and all issues related to airborne infections or not. We still don't have a strong evidence that would support this. But at the same time, we have been saying that in closed settings that are not well ventilated, the possibility of airborne might be considered, but this was pretty much confirmed first at healthcare facilities, but now also we're hearing or we're collecting more evidences that might be the case. We don't have strong evidence yet to make this assumption as a universal assumption. It seems that still more studies need to be conducted in order to get more confirmation on whether this is an airborne infection or not. The incubation period that we know so far is basically ranging from 1 to 14 days. The average or the median is 5 to 6 days, but more than 97% of the population or the infected people have developed their symptoms within the 14. Basically shows when people can recover them from this infection. And according to the information that we have, is that the mild and moderate cases, they recover 2 weeks after the onset of symptoms, but this basically takes much longer for those who are severe or critical or develop critical conditions. If you move to the next slide, I don't want to go into the complexity of it. Just two main messages is that at the moment, the viral replication occurs in the upper respiratory tract. We do have some informational tract, but at the moment, we really don't have strong evidence that would support the fecal oral transmission. Pre-symptomatic transmission is likely to occur. At the same time, you really need to have having symptoms. For example, if you're speaking or singing in a very loud voice in a way that would generate some droplets, that would be the way of a transmission. If you move to the next slide, this basically talks about the super spreading event. And again, without explaining too much, just to give you an idea that in some events where we have a lot of people available at one point or at one venue, if you want, there are some people who are capable of spreading the infection, not to 1 or 2 persons, it can reach to more number of people. And these are pretty much related to mass gatherings, some displaced population, etc. But I tried to put this in order to relate this kind of setting at the schools, because we understand that in some schools, the setting is pretty much very crowded, and therefore, if there might be an infection, this needs to be taken into consideration. If we move to the next slide, and again, when we talk about school, we know at the moment that children or young adults, that they're considered among the low risk, which means that if a child is infected, the possibility for this child to infect others is pretty much very minimum. But at the same time, the child can infect adults, and therefore the cycle may continue. But according to the information that we have, low risk is children and adults, and the high risk, the risk groups that we are pretty much aware of. Just a little bit of information, but it's really coming from China and USA, because we don't have yet all the data set, if you want, for this information. The proportion of infection for children 0 to 9 years is pretty much around 1%, and from 10 to 19 years, it's pretty much around 2.5%. And again, this percentages or proportions can be different from one country to another. And we do encourage the data collection, but also the stratification per age group in order to see the impact on children. So now focusing on school setting, if you move to the next slide, and the data that we have so far, the data that we have so far, it's basically related to pandemic influenza or influenza-related settings or influenza-related studies, if you want. And we're trying to see whether this can make sense in the context of Corona, or there is really few studies that has been conducted to involve educational institutions, and there is little data that would show transmission in the school settings, but it can be related it's basically to the school rooms. So if we move to the next slide, and this is the big question that everybody is asking, what is the benefit of reopening the school? And we know very well that, of course, I mean, as Janet's dropping out from schools, we want to make sure that people are not affected by socioeconomic homes. So let's say parents might not be able to go to their work because they have to take care of their children. And then the last part is related to some services that are being provided in schools, and this is basically related to some nutrition programs or even vaccination. And therefore, this really raises a big concern in terms of the continuation of schools or returning back to schools. So the next few slides, I will talk about some consideration for the safe back to schools. So if you move one slide, please. And this is some of the main issues that you need to consider in order to be able to decide whether a school or a university should open or not. The most important thing is that we really need to understand the EP situation, and not necessarily in the whole country, because the situation in the country might be different from one place to another, from one district, from one city, from one province. And therefore, an EP discussion or analysis have to be targeting each area in order to be able to decide whether a school in this specific area can reopen or not. We need to look into the different public health capacities in terms of whether the system will be able to early detect cases, how we can refer the cases that will be detected in schools to health facilities, etc. And the most important thing is, do we see the coordination is going very well between the health sector and the education sector in a way that will help in aligning messages and making sure that each school have the right preventive measures for the safe back. If we move to the next slide, and this is mainly related to the infrastructure or the school setting, and we want to make sure that in each school we have enough resources that would allow maintaining the hygiene, maintaining the physical spacing. But the most important thing, you have enough material, you have enough teachers that would be able to cope with a new setting for the schools in case that the school will decide to reduce the duration of classes, to extend the number of increase the number of shifts. So you want to make sure that you have all the resources available that would help in coping with this new strategy, if you want. If you move to the next slide. And again,
Dalia, one more minute. Yes, can you wind up? Thanks.
Yes, yes, sure. Of course. So basically, this is related to the sum of the activities that is being conducted in schools. So school activities also you want to take into consideration the right behavior that needs to be promoted. You have to find alternatives in coordination with parents on how to cope with the different activities. To the next slide, please. And again, this is related to security and that safety in terms of making sure that programs are being maintained related to psychosocial support, related to nutrition programs, vaccination programs, etc. Main recommendations that we want to make sure that each school is having in place. I mean, I don't want to repeat what I said in terms of the hand hygiene, in terms of making sure that you have all the washing, places or facilities that you continue or you have access to maintain the hand hygiene. We don't recommend the use of masks, but if it will be decided and because the distance might not be maintained, then there should be some education on how the proper use of masks need to be done. Procedures related to the screening of students when they're getting to school in terms of measuring temperatures, but also some information to be collected and whether they have been in contact with cases or not. The line of communication between parents and schools is very important to maintain, and most important is to make sure that also the messages are not only going to students but also going to parents in order to always promote the preventive measures and making sure that we are in a process or in a position to protect our children. The next slide, again, we talked about the physical distance, which is at least 1 meter. So you want to make sure that in the new opening of and the last one is basically related to the schooling and distance learning in situation where you have to close the school again because this is occurring in the area where the school is located. You need to make sure that you have kind of a blended approach in terms of the distance learning and the school related learning. That can be on computers, that can be TV programs or radios, etc. But this has to be decided ahead of time in order to make sure that there is a continuity of the educational process and it's not being interrupted in the middle. The last slide is about having some indicators that would help you to monitor the situation and making sure that, no, next. Yes, next one, next, I'm almost done, I'm done, yes, this one. These are the areas that you need to think of some indicators that would help you to monitor the situation and make sure that you have the capacity to adapt your strategy related to the reopening. And let me close the presentation by saying, my last slide, please. And this is a quote from John Kennedy, children are the world's most valuable resource and its best hope for the future. So it's really important that we put our hands together in terms of parents, health sectors, education sectors, or international organizations in order to make sure that we have all the needed for the safe back to schools. Thank you so much.
Thank you very much for this presentation. I think it brought out some of the challenges we are facing with when we're moving towards reopening up schools. Now we have run out of time a little bit, but just I will give some time for some questions, although some of the questions may have been answered already or will be answered through the next of the presentations. Also, of course, the answer is not just with the presenters, but with all of us. Maybe the first one is related to the presentation from UNESCO about increased class time, the preparedness of teachers, the possibly, and particularly not only for the teachers, the preparedness, but also the possibility of teachers to their turnover when the school year opens, retention of teachers, and so, which are important aspects. And then the second, and then also indeed something that was already touched upon by the last speaker about blended learning. So when schools reopen, of course, we will need to consider alternatives or different ways of working than we did before. Also in light of the fact that we need to catch up with time, lost learning, we need to ensure that we observe physical distancing, and we need to ensure that we are prepared for possibly future lockdown. First of all, okay, Juan, if you want to pick on the issue of class time instruction, increased class time versus blended learning approaches, and maybe teacher turnover and retention. Over to you.
Thank you, Diana. So the class time that was referred to in my presentation was a question asked in the survey questionnaire, and it meant whether countries are planning to increase the time of class hours to make up for the loss during the confinement period. There are not many countries that were planning to increase the number of extra hours. For instance, if there were 5 hours teaching per day, there are some countries wanting to add 1 extra hour to increase the class time. So this is what we meant, and what I do see is that according to the response that we received, 30% of countries globally were planning to increase the class time, while this percentage or proportion was like 22% in countries of the Arab region. Second, quickly about the blended learning, and I think everybody says that the crisis provides the opportunity that the education systems worldwide try to bring in some innovative aspect of blended learning. Education system, they were talking about it, innovation, transformation, and so on, but actually the crisis forced many countries to try it out. And also it revealed that it didn't work. And I think this experience is wonderful experience that countries should continue working on. I would say that blended learning is the future. We have to see leveraging the benefits and also of each of the distance learning and the class-based, school-based teaching, so that we can leverage the best of what these teaching or learning programs can offer. So yeah, I think countries are continuing, and what I do see is that many countries, especially in South Korea and so on, they definitely say that this is the way to go, and they would like to reform and transform their education systems, drawing lessons from this period. Turnover of teachers, that's true. It's there are different reasons, where teachers, they're scared to come back to school for different reasons, or there are cases of losses as well. While at the same time, countries they plan to recruit more teachers, new teachers, because the sanitary situations require that we do respect a number of measures like spacing, distancing, and so on, and sanitary measures. And so this is what we do see. Country situations are different depending also on their financial situation. And so we still, UNESCO continue to monitor what happening at country level in order to not only share this experience with countries, but also draw lessons from this experience in order to trigger and stimulate dialogue for education transformation in the future.
Thank you very much. I think there are many more questions and also observations which are very valid in the chat box, the question and answer, and I think also would stimulate the following speakers maybe to reflect on some of these issues, on, for example, on how they think this will be an opportunity to indeed contribute to transformation of the systems, how they think they will deal with some of these challenges which were raised about capacity of schools to indeed address physical distancing or capacity of teachers and a system to apply a blended learning approach and things like that. I think this will be very important also to hear from the countries on how they will how they plan to address this. Maybe also linked to that, there were some questions about some of the resources and support us as UN organizations are providing. Reference was made to the McKinsey toolkits. Please go in the coalition. Other organizations are also preparing a lot of toolkits, all in support of country-level decision-making and implementation with regard to reopening schools. UNICEF, for example, is moving on to developing of a teacher preparedness training package, which could help once the schools reopen to make sure that teachers are on the right track and prepared for the challenge they're facing as a consequences of having schools closed for the last 5 months. And please go and look for those resources. We will go and also share those resources with all of you and have some follow-up discussion on that. Now over for some last questions to Dalia. Dalia, questions were raised with regard to questions about different types of COVID. Is that why there's no treatment? How may climate here in the region affect the spread or non-spread of the virus? And maybe lastly about particularly your strong messages at the end with regards to reopening schools. How could we collectively support the communication around that at country level, regional, and possibly global? Do we have certain messages we can convey to take away, for example, the fear, particularly of parents and teachers, that even when governments take the decision to reopen up schools, that they actually will send their children to that? Over to you, Dalia, for your reflections on those questions.
Thank you so much, Janet. So on the first question related to treatment, I'm sure that all the colleagues, they know that at the moment there are several number of clinical trials are ongoing in order to look for some effective treatments, whether the Solidarity trial that is being conducted by WHO, or even some separate trials, big trials as well, whether by USA or by UK. At the moment, unfortunately, we don't have yet any confirmed treatment to be effective for corona, except the dexamethasone that has WHO announced recently that it's effective, but only for the severe cases, and it also proved to reduce mortality among the severe cases. We don't have, but this treatment is not used as prophylaxis. You cannot use it for mild cases or even moderate cases. So far, clinical trials are still ongoing. We are collecting information as much as we can. Different studies are being reviewed, systematic review as well, in order to see whether we have a therapeutic that can be used or not. So this really adds to the fear that everybody is having, because again, a treatment is not in place, and the production of vaccine will take long time to have it. I mean, even if we will have it, let's say towards the end of the year, production or the massive production of vaccine usually takes very long period of time. And this is exactly your last point in terms of, we have a lot of fear, we don't have treatment, and therefore it's very important that we focus on the preventive side. And the preventive side, the most important thing is to make sure that people are aware of the virus, how it is transmitted, how they can protect themselves, and how they can contribute to the protection of their loved ones or their families. It's unfortunately that at the beginning of the outbreak, we've seen a lot of people, they were really panicking and they were really taking extra precautionary measures to protect themselves. But this has gone. I guess there is a long or if you want, a lot of community fatigue. People are not able to take it anymore, and they prefer just to live their normal life. I think this is a new normal life that we are living. Having said that, that does not mean that we do not take all the precautions to protect ourselves. And this makes me highlight the important work that WHO with UNICEF and IFRC are doing concerning all issues related to risk communication and community engagement, and making sure that we have the right messages, and making sure that we are delivering the message, the right message to the right target audience. It's very important that we understand how people think, and therefore, if we're opening schools, one of our target audience will be children, their parents. So I would suggest that we also conduct some surveys to understand the perception and behavior of children and parents. This will help all of us to put in place targeted or tailored interventions that would help in making sure that everybody is really taking the right approach for the protection. The virus, so far, we know it's being transmitted as a human to human through droplets, as I said, but also through the contaminated surfaces. And this is why we keep stressing on the fact that you really need to maintain your hand hygiene. You really need to maintain your respiratory etiquette. You really want to make sure that you always keep the distance of at least 1 meter, regardless where you are. If you cannot maintain the distance, use the mask, but you really know how you use the mask in a proper way, because sometimes if you're not using the mask in a proper way, that would be a tool of spreading the infection from you to other persons, or maybe infecting yourself as well. These are the key messages that we want to focus on, and we want everybody listening to us to take these messages and to put them in the right format, if you want, and to see how those can be used to target every single person, so we all of us can put our efforts together to protect children, and making sure that there is a way for the safe back to schools. Thank you.
Thank you very much for this elaboration, and also putting the focus back to children and their parents. There are lots of other questions in the chat box and a question and answer, and we will try to do them justice in the report and coming back for you. This is an ongoing discussion, and I think maybe we may not have all answers for every question. So it's also very much over to us to take it forward in the debate and to find solutions together. Now I hand back over. I thank Dalia and Juan for their inspiring presentations. And I now hand over back to Dagmara for entering the new session, the next session. Over to Dagmara. Thank you.
Shukran, Jeanette and Hind, for the facilitation and for also managing the rich question and the comments part. And thanks also to our two panelists, GC from our UNESCO headquarters and Mrs. Dalia Samburi, a medical doctor from WHO. This was very rich and informative. And as Jeanette said, we will try to process all what was said so that after the two webinars, participants are provided with all this information and some key messages. And I liked very much what Dr. Dalia just mentioned at the end. What are our key messages and how we package them so that they reach out to those working in education systems, from teachers, parents, but also ministry people, and the last but not least, the children, the learners that are to resume hopefully a new way of learning in schools. Now we will close this first part and we'll switch to the second section of this morning, which comprises the presentations from some of our Arab countries. Last May, and Jeanette mentioned that, we had 5 countries and organizations presenting, and these were actually Egypt, United Arab Emirates, Lebanon, Morocco, and UNRWA. We could learn from these presentations about the way countries deal with this uncertainty, with different scenarios. I also mentioned, I was about to mention when GC was talking about exams and the fact that in the study in early June, no Arab country appeared as having canceled the exams, but the situation evolved. And it's a kind of volatile situation, so data may change because, for instance, in Lebanon, the ministry canceled all high-stake exams, so this data has to be also revised. And the country policies, they are also in the process of being reviewed as we go. One of the questions and comments that has been addressed was mentioning this importance of dealing with short-term responses and longer-term responses, and how to develop roadmaps for these two different situations. So now this time we hope to hear more from our colleagues from Jordan, from the Kingdom of Saudi Arabia, and from Tunisia. I want also to introduce with this session our colleague, Mrs. Hana Yoshimoto, who's our new Chief of Education in UNESCO Beirut. She will co-facilitate with me this session. So this is her first presence, I think, in international, regional, actually, activities. So welcome, Hana.
Thank
and you will introduce the second country, so you will introduce Kingdom of Saudi Arabia. Now I have the privilege to introduce our first speaker, Mr. Youssef Abu Shar from Jordan, representing the Ministry of Education. He's the Managing Director of Planning and Educational Research. So please, sir, 10 minutes.
Thank you, everybody. I'll start speaking in Arabic as yes. Part of my knowledge that there is translation.
Yes.
So allow me to speak in Arabic. برحب بالجميع. أهلا وسهلا بالجميع. بداية نشكر اليونسكو ومنحدد كمان.
I listen to English.
وتحديدا يونسكو بيروت لهذا الاجتماع الثري بالمعلومات واللي هو كمان بنشكر كافة المنظمات الدولية اللي عم بيشتغلوا علشان نتواصل في التعليم ونوصله لأبنائنا الطلبة على مستوى الوطن العربي وعلى مستوى العالم. Hello. Shall I continue?
Interpretation is not working.
أستاذ يوسف ممكن تعمل share screen?
Just a hand. It's not working, the interpretation.
Yeah.
I can hear you. We can hear you now speaking English now. Yes.
Yeah.
Brilliant. Brilliant. Thank you. Yeah, please.
في الواقع احنا كباقي الدول على المستوى الوطني والعالمي اوقف عندنا التعليم بسبب وكان ذلك في 15 شهر 3 في هذا العام. في 17/3 بدأت وزارة التربية والتعليم في الأردن في العمل على توفير التعليم عن بعد. ومن ثم أنجزنا محتوى التعليم عن بعد وكذلك الامتحانات، وصارت الحمد لله عن طريق الشراكة الفاعلة مع جميع المنظمات الدولية والوطنية. من ثم وكذلك تم بث من خلال 3 قنوات وطنية المحتوى التعليمي كامل للفصل الثاني طبعا. وأجريت الامتحانات عن بعد كذلك للصفوف من الصف الأول للصف العاشر، ومن ثم وبعدين الصف التوجيهي هلا عم تجري امتحاناته بتباعد. يجري حاليا في هذه الأوقات طبعا امتحان التوجيهي. احنا بنعرف عندنا في الأردن كان التخطيط على انه يكون في خارطة لطريق العودة للمدارس، وهذا طبعا كله يعتمد على ما ستؤول اليه فيروس كورونا بسبب الضبابية طبعا غير وضوح ما ستؤول اليه الامور في الاشهر القادمة بسبب الجائحة. أكيد كانت الشراكات هي الهدف الرئيسي للوزارة أو ما ساعد الوزارة. اللي ساعدت وزارة التربية والتعليم على التخطيط والشراكة ضمن بروتوكولات وضمن خطط مشتركة ما بين كافة الوزارات المحلية في المملكة الأردنية الهاشمية وكذلك المنظمات الدولية المعنية في الأمور الوقائية والصحية. Not only the Ministry of Health, and I mean to say all the ministries in all over the country, and also the partners, yeah. So, والشركاء الوطنيين والدوليين في بدء العام الدراسي. هلا حطينا احنا مرتكزات رئيسيه للعوده للطريق لخارطه الطريق. طبعا مثل ما حكيت انا اعتمدنا مبدا التشاركيه لعمليات التخطيط والتنفيذ لذلك. هنا اتوقف للشكر للمنظمات الدوليه ولا استثني منهم احدا طبعا. اللي هم اليونيسف واليونسكو اكيد والمنظمه الصحه الدوليه وكافه ما بدناش على يعني خلينا نقول لكافه الشركاء اللي المساهمين في المملكه الاردنيه الهاشميه هلا المرتكز الرئيسي الثاني اللي هو العوده او تجهيز البيئه لسير العمليه التعليميه في الاردن، وهذا سيكون اكيد قبل بدء الدراسه التاكد من السلامه العامه والبنيه التحتيه والموارد الماليه والماديه والبشريه مع تخطيط مناسب مع تخطيط للمخاطر الرئيسيه وكيفيه معالجتها على المستوى التنفيذي. And risk management to be implemented in the school level also. هنا بعديها طبعا عم نطور، واليوم كنا في اجتماع في تطوير سيناريوهات للعوده للمدارس اللي هي على اكيد اللي هي بتضمن سلامه الطلبه والمعلمين والعاملين كافه في المدرسه. طبعا هنا اكيد بدها تكون من خلال عمليات التدريب لكافه مكونات المدرسه خلينا نحكي. وكذلك بالتعاون المباشر والرئيسي مع وزاره الصحه في الاردن. Ministry of Health. بعديها هلا اعطينا مزيدا من الصلاحيات من خلال فوضنا مزيدا من الصلاحيات للمستوى التنفيذي لمدراء التربيه والتعليم في الاقاليم وكذلك للمدارس نفسها. And also decision making tools means they have more decision. على المستوى التنفيذي. Implementation level, on the implementation level we can say. Yeah. هلا طبعا بقراراتهم هم بيعيدوا تنظيم عمليه تقديم الخدمات على مستوى المدرسه اللي هي الحصص طبعا للطلاب، وكذلك ترتيب اوجه المعلمين في المدارس التي تحتاج لذلك طبعا. هلا اكيد عشان نضمن سير العوده الامنه في المدارس تم وضع خطه وضعنا خطط للطوارئ خاصه على مستوى المدرسه. السكول طبعا كلها كانت بروتوكولات مع وزاره الصحه الاردنيه وكذلك المنظمات الدوليه المعنيه بمسائل الصحه. هلا طبعا هلا اكيد بموضوع التوعيه والتثقيف والتدريب في البدايه حول الوباء هو مستمر على مستوى الدولة الأردنية، وكذلك في تخصيص على مستوى وزارة التربية والتعليم. طبعا احنا عم نحكي هلا عن خارطة الطريق كخارطة للعودة كاملة، يعني ما حددناها بخطط لانه فوضنا صلاحيات للمدارس صلاحيات اكبر للمدارس. طبعا على احتياجات الدعم النفسي والاجتماعي للطلبة وجدنا انه من الضروري.
Mr. Youssef, sorry to interrupting you. You have maybe 1 minute left, and very sorry for these interpretation problems, because we were not supposed to do consecutive translation, but this is happening now. We have a technical issue, but please, if you can summarize in maximum 2 minutes. Thank you very much.
اوكي احنا هنا ركزنا كمان على الطلبة في المناطق الأقل حظاً.
Hello, Mr. Youssef, can you still hear us? Hello? Hello?
We can hear you.
Yeah, I don't know if Mr. Youssef can hear us, but I think there is a connection issue. So thank you very much, Mr. Youssef, and there will be some opportunities for you to get back to some of the issues or to elaborate on these issues during the question and answer sessions. We lost you now, but we will have the question and answer session afterwards, so you can then complement your points with some issues that the participants will raise. I'm now giving the floor to our colleague, Mrs. Hana Yoshimoto, to introduce our second speaker from Kingdom of Saudi Arabia.
Yes, thank you, Dakmara. Yes, so we have a second speaker to share the experience, Mrs. Tahani Ms. Tahani Al-Dosamani. She is a senior advisor to the Minister of Education from the Kingdom of Saudi Arabia. Ms. Tahani, 10 minutes is yours.
Thank you very much, everyone. Thank you, Hannah, and I'll switch to Arabic now. سعد الله جميع أوقاتكم بكل خير. سعداء بالتواجد معكم اليوم للحديث عن تجربة المملكة العربية السعودية في إنجاح التعليم عن بعد وضمان استمراريته في ظل جائحة كورونا. ونتقدم بخالص الشكر والتقدير لمكتب اليونسكو بيروت، ممثلا مكتب اليونسكو الإقليمي للتربية في الدول العربية، والمكتب الإقليمي لليونسيف، وجميع المنظمين لهذه الندوة الهامة على دعوتهم الكريمة لمشاركة تجربة المملكة، ولجميع الحضور الكرام. اسمحوا لي الآن أن نشارك السلايدز. كما نعلم أن أزمة جائحة كورونا كان لها الأثر البالغ على كافة مناحي الحياة، والتعليم بلا شك لم يكن استثناء. وعلى الصعيد العالمي. Can you hear me?
We can, but we don't hear.
Sorry, can you see my screen? Miss Dakmara? Okay. So, فعلى الصعيد العالمي نرى أنه تأثرت دول العالم بقرار تعليق الدراسة، وأغلقت المدارس في جميع أنحاء العالم ليصبح أكثر من 1,600,000,000 طالب وطالبة خارج الفصل الدراسي، سواء على مستوى المدارس أو الجامعات. وللحديث عن دور الاستعدادات المبكرة للمملكة للاستجابة وسرعة وفعالية الاستجابة، فقد كان للاستعدادات المبكرة للجائحة الأثر الإيجابي الكبير لدعم وتعزيز فاعلية الاستجابة، حيث بدأت استعدادات وزارة التعليم لمواجهة جائحة كورونا في الأول من فبراير بتوجيه ودعم من لدن القيادة الرشيدة حفظها الله، والتي دائما ما تضع الإنسان أولا، وذلك في فترة قياسية تقدر ب10 ساعات فقط انطلقت على إثرها الوزارة بتحديث خطط الطوارئ الداخلية وخطط الأزمات ورفع الجاهزية والحملات التوعوية لدعم تدعمها اللجان المتخصصة وفرق العمل لضمان استمرارية العملية التعليمية بجودة وكفاءة. ولعل الجدول الماثل أمامنا يوضح الخط الزمني لسرعة وفاعلية الاستجابة. فبعد مرحلة إعداد الخطط ورفع الجاهزية وصدور قرار تعليق الدراسة في 8 مارس، تم التحول مباشرة في 9 مارس من الدراسة الحضورية إلى الدراسة عن بعد من خلال 14 قناة تلفزيونية مخصصة لكل مرحلة وصف دراسي وفق جداول دراسية تم التخطيط لها، مع الاستمرار بتقديم خدمات التعليم من خلال منظومة عين الإطرائية وبوابة المستقبل، وشملت الجهود كذلك تشكيل لجنة عليا لمتابعة تفعيل الجامعات للتعليم عن بعد. أما في 10 مارس فقد تم حصر الاحتياجات في البنى التحتية التقنية وتقديم الدعم الكامل لشطري التعليم العام والجامعي وتدشين منظومة التعليم الموحد للتعليم العام. وفي 15 مارس تم تقديم الدعم التقني للمنصات التعليمية، ومن ثم صدرت الأدلة الاسترشادية لآليات التقويم النهائي للجامعات والتعليم العام في 18 مارس. لذا فإن هذه الترتيبات والاستعدادات حققت أو ساهمت بتحقيق التحول الكامل لنمط التعليم عن بعد بنسبة 100% بعد يوم واحد فقط من تعليق الدراسة حضورياً. وللحديث عن الدعم المقدم للمكونات الرئيسية لمنظومة التعليم العام والتي شملت المدرسة والمنهج والطالب والمعلم، فقد تم توفير مبنى المدرسة للبث الافتراضي بكافة متطلباته ومعداته وشرح الدروس اليومية، كذلك إعداد اختبارات تشخيصية للعام الدراسي الجديد لتحديد مستوى الطلاب، وأيضا كان الهدف لقياس حجم الفاقد التعليمي. أما فيما يتعلق بالمنهج فقد تم تركيز محتوى المنهج على المهارات والمعارف الأساسية ووضع الخطط اللازمة الاحترازية في حال تم حظر التجول بالشكل الكامل لمدة 24 ساعة، وذلك من خلال شرح الدروس من مقر سكن مقدمي الدروس أو من يعمل على مراجعتها، مع توفير كافة المعدات اللازمة لذلك. من ناحية الطالب فقد تم توفير خيارات تعليمية متعددة للطالب، متزامنة أو غير متزامنة، تتناسب مع كافة البيئات والفئات المختلفة في حال توفر خدمة الإنترنت أو بدون خدمة الإنترنت، ليتمكن الطالب من استكمال عملية التعلم عن بعد مع توفير كافة الأدوات اللازمة لتحقيق التفاعل اللازم ما بين المعلم والطالب وتنفيذ ما يتعلق من ذلك من واجبات وأنشطة. أيضاً فيما يتعلق بالمعلم فقد تم ربط المعلمين بالطلاب من خلال منظومة التعليم الموحدة وتوفير كافة البرامج اللازمة للمعلمين والمعلمات مثل ويكام وكمتيجا وتدريبهم عليها عن بعد ليتمكن مقدمي الدروس من تسجيل الدروس ومراجعتها بطريقة احترافية من منازلهم. وسأنتقل للحديث عن الخطة الاستباقية التي أجريت، وذلك في وقت وجيز جدا منذ صدور قرار توقيف الدراسة، والتي تم رسمها على 6 مراحل. ففي المرحلة الأولى تم وضع الخطط والتصورات المحتملة لإدارة الأزمة وإكمال العام الدراسي، مع الاستمرار في العملية التعليمية للعديد من المؤسسات التعليمية سواء في التعليم العام أو الجامعي. المرحلة الثانية كانت عملية وضع وثيقة المحتوى المركز للمقررات الدراسية والتي تضمنت المعارف والمهارات الأساسية، مع الاستفادة من الموارد المتاحة التي تدعم العملية التعليمية عن بعد. المرحلة الثالثة كانت بإصدار أدلة تنظيمية للتعليم عن بعد وتوظيف المحتوى المناسب، ولذلك المحافظة على استمرارية والمرونة في اختيار الأدوات والأساليب المتنوعة للتدريس. أما المرحلة الرابعة فكانت بإعداد ومعايير اختيار المعلمين والمعلمات، المقدمين للدروس عن بعد، تقديم كافة الدعم والتحفيز لأساتذة الجامعات من خلال تدريبهم على استخدام الأنظمة بكفاءة والتأقلم السريع على تفعيلها. أما المرحلة الخامسة فكانت بتدريب وتحفيز الطلاب على الحضور ومشاركة الأنشطة والواجبات وبناء المهارات التي تتوائم مع الوضع الراهن. أما المرحلة السادسة والأخيرة فكانت في إعداد خطط المراجعة لكامل المقررات الدراسية لطلاب التعليم العام، وإجراء التقييم لطلاب التعليم الجامعي على الاختبارات عن بعد ودعم احتياجاتهم أثناء هذه الأزمة. والحديث عن القنوات التي وفرتها الوزارة، فقد وفرت الوزارة 6 خيارات للتعليم عن بعد لطلاب وطالبات التعليم العام والأهلي، وذلك لتلبية كافة الاحتياجات. فمن خلال
Dr. Tahani, 2 more minutes, okay?
من خلال منصتين تفاعليتين للتعليم عن بعد لأنظمة إدارة التعليم الإلكتروني، و4 منصات مفتوحة للتعليم الحر. ويمكن للحضور الكرام قراءة الإحصائيات الكبيرة لعدد المتفاعلين، عدد الاختبارات، عدد الفصول الافتراضية، عدد الواجبات والمحتوى الإلكتروني، عدد القنوات التي قدمت التعليم الحر، 20 قناة حضرها أكثر من 6 ملايين مشاهد. أيضاً وفي نهاية رحلة التعليم خلال فترة تعليق دراسة حضورياً في 8 مارس قدمت وزارة التعليم عدة خيارات لاعتماد نتيجة الفصل الدراسي ونقل الطلاب للمرحلة التي تليها من خلال خيار اعتماد نتيجة الفصل الدراسي الأول، أو اعتماد إضافة نتيجة التقويمات من خلال خيارات التعليم عن بعد، أو أداء الاختبار بداية العام الدراسي القادم كأداة تشخيصية لمعرفة وتحديد الفاقد التعليمي وعمل المعالجات قبل بداية العام الدراسي. أما بالنسبة للمرحلة الثانوية فقد تم أداء الاختبار عن بعد مع توفر كافة المتطلبات اللازمة، أو خيار حضور الطلاب لأداء الاختبار حضورياً. هنا نجد إحصائيات نجاح التعليم عن بعد في المملكة العربية السعودية للتعليم الجامعي، فنرى كمية التصفح للمحتوى التعليمي أكثر من 108 مليون تصفح للمحتوى. نجد أيضاً الأرقام كبيرة جداً لإجمالي الفصول الافتراضية، أكثر من 1,800,000 فصول إجمالي جلسات الفصول الافتراضية، عدد كبير من الجلسات المتزامنة، حضور عدد كبير من الحاضرين جميع الجلسات، عدد كبير من ساعات الفصول الافتراضية، وأيضا عدة منصات التي قدمت التعليم عن بعد للتعليم الجامعي من خلال بلاك بورد، زوم، وأوفيس، ومايكروسوفت تيمز وغيرها. أيضاً هذه النجاحات ترافق معها بعض التحديات والتي استطاعت وزارة التعليم التعامل معها بنجاح، مثل نقص بعض الأدوات التقنية والأجهزة، ضعف توفر خدمة الاتصال بالإنترنت أو عدم موثوقية خدمة الاتصال بالإنترنت، ضعف التصفح وعدم تحمل الشبكات والفصول الافتراضية. ونرى أمامنا هنا نظرا لضيق الوقت استعرض معكم بشكل سريع كيف تعاملت وزارة التعليم مع هذه التحديات. وفرضا لنقص الأدوات التقنية قامت بمبادرة توزيع الأجهزة وافتتاح 20 قناة فضائية للبث اليومي. أيضاً لتحدي ضعف توفر الاتصال تعاملت الوزارة مع هذا التحدي بالعمل على مبادرة إتاحة الوصول للمواقع التعليمية. أيضاً دعمت 20 قناة فضائية هذا التغلب على هذا التحدي. أيضاً من ضمن التحديات عدم توفر أجهزة كافية للعائلة الواحدة، فسعت الوزارة لتسجيل جميع المحاضرات وإتاحتها على الشبكة. عدم حصول شريحة من المشاركين في العملية التعليمية على التدريب، قامت الوزارة بإعداد فيديوهات تعليمية وعقد ورش تدريبية عن بعد وقدمت لهم الدعم المباشر. أيضاً محدودية أنظمة التعليم الإلكتروني وتوقف أحياناً البلاك بورد، قامت الوزارة بزيادة وتفعيل بعض الأنظمة التعليمية المساعدة وزيادة سعة الخوارج. بلاك بورد sorry one more minute. أوكي. فأيضاً قلق بعض الطلاب، تم الإطلاق مبادرة للإرشاد الجامعي الافتراضي والساعات المكتبية. آخراً وليس أخيراً التعليم عن بعد ما بعد جائحة كورونا. فالوزارة الآن وزارة التعليم تعمل على دراستين لتقييم وتوثيق تجربة التعليم عن بعد وأهم الدروس المستفادة منها. أيضاً أعدت الوزارة اختبارين، الأول على مستوى المدرسة لقياس التحصيل الدراسي في الفترة السابقة، والثاني على مستوى الوزارة لتقويم حالة التعليم. أيضاً وفرت الوزارة منصة الاختبارات الوطنية وبنوك الأسئلة على مستوى مقررات التعليم والعالي. أيضاً العمل على استمرار أسبوعين عند بداية العام الدراسي استثمارها للمراجعات وتعويض الفاقد التعليمي. أيضاً قامت الوزارة بإعداد السيناريوهات الكاملة للعام الدراسي القادم بشكل مرن يتناسب مع حالة كل مدرسة أو مكتب تعليم أو جامعة وفقاً للمتغيرات الصحية والبيئية. وقامت الوزارة باستكمال البناء والاستثمار في المدرسة الافتراضية للرفع من كفاءة الإنفاق وجودة التعليم. وشكراً جزيلاً لكم على حسن الاستماع.
Okay, thank you very much, Ms. Tahani. This was very helpful. It's really quite impressive about all the early reaction and responses that your government has put in place. We'll go to the third presenter, Dakmara.
Thank you, and sorry, Dr. Tahani. Again, like Mr. Youssef from Jordan, you will have some time also for the question and answer session, and then you can elaborate on certain issues that you did not have time. But I would like to thank you very much, and I am sure a lot of questions and comments will be addressed with regard to the Saudi Arabia experience. Now, I'm pleased to introduce to you Mr. Hatem Amara from Tunisia. Bonjour. The General Director for the Intermediate and Secondary Education in the Ministry of Education of Tunisia. Can you hear us, Mr. Hatem? Dr. Hatem, can you hear us? Please unmute. Hello? He's not unmuted. Hello? Hello? Can he?
يفتح الميكروفون يا دكتور.
Can he unmute himself or we have to unmute him?
Oh, he has.
Please, Dr. Hatem, if you can unmute yourself. Okay, now it happened. Yes.
أهلا وسهلا, صباح الخير.
صباح النور. Okay, so will Dr. Hatem use the screen and share his screen, or will we assist him?
Okay.
Ellie?
Okay, thank you.
So we will assist with the screens, with the sharing of the screen. So Dr. Hatem, please proceed.
Dr. Hatem?
شوفوا أنا سأتحدث باللغة العربية. تسمعوني؟ وأنت هل تسمعوني أو لا؟ تسمعوني تو ولا لا؟
الآن نعم.
باش نقدم لكم. تسمعوا فيا توا؟
نعم دكتور، توكل الله تفضل.
شكرا. تحية طيبة لكل الحاضرين، أهلا وسهلا. باش نقدم لكم تجربة تونس، رغم اللي تونس مرت بظروف خاصة، خاطر ما كانش فما تأثير كبير على تونس، خاطر الكوفيد يتسمى ما مسش تونس بطريقة كبيرة. كان عندنا عدد صغير من التأثيرات. سامحوني، ثم مشكل صغير في سلايد. قلت تونس ما كانش عندها إشكالية كبيرة، خاطر في تونس كان تسجيل عدد صغير من المصابين بالمرض. إلى حد الآن ما فاتش 1200 متأثر. هذايا ما منعش اللي تونس خذت احتياطات كبيره، خذت احتياطات على اساس اوقف التدريس منذ شهر مارس يعني تم ايقاف التدريس. وهذا كان ليه، سامحوني عندي مشكل تقني صغير، مشكل تقني. تم انهاء انهاء السنه الدراسيه لكافه المستويات التعليميه باستثناء الاقسام اللي عندهم امتحانات وطنيه. الامتحانات الوطنيه تم اجراءها مثلا اليوم انطلق امتحان البكالوريا، ل 133 ألف مترشح، رغم اللي وقت اللي خذينا قرار انه يكون ثم الامتحانات برشا ناس لاموا علينا قالوا لنا انتم تحطوا الناس في خطر، لكن هذا ما منعش اللي مشينا للتمكن من المستوى العلمي للتلاميذ باش يكون موجود، انه خيرنا انه ننهيو السنه الدراسيه لكافه المستويات الا بالنسبه للبكالوريا وبالنسبه للاقسام المعنيه بالامتحانات الوطنيه. اللي صار هو انه بخلاف هالاجراء هذا حضرنا انفسنا باعتماد المنصات الرقميه. رغم اللي ثم مشكل نتاع تكافؤ فرص، على خاطر المنصات الرقميه مشي على ذمه كل الناس. ثم ناس ما عندهاش تجهيزات اعلاميه، وثم ناس ما يوصلهاش البث يعني الانترنت. ثم بعض الاماكن في الجمهوريه اللي ما توصلهاش الانترنت. هذا علاش تم خلق قناه تلفزيه جديده. هو تبارك الله في السعوديه عندهم 20 قناه، في تونس تمكنا باش نخلقوا قناه. يعني هذايا اللي كان صعيب شويه، خاطر صعيب ما عندناش التجهيزات الممكنه، لكن خلقت قناه في 3 أسابيع، قناه جديده، قناه تلفزيه. ورغم هذا ثم مشكل في التلفزه
هذه المشكله الان
المدرسيه، خاطر التلفزه المدرسيه في العائلات في اكثر الاحيان العائلات عندها تلفزه وحيده، وبما انه ثم حظر صحي الناس يستعملوا في التلفزه. وهذا علاش قلنا او الانترنت لتقييم التلاميذ. يعني عمليه التقييم ما تنجمش تكون على اساس تعليم عن بعد. وهذا علاش بالنسبه للبكالوريا رجعنا التلامذه لمده 4 أسابيع لاتمام البرامج نتاعهم، وتوا اليوم انطلق امتحان البكالوريا. ايضا انطلقوا منذ الاسبوع الفايت انطلقوا امتحان شهاده ختم التعليم الاساسي اللي هي المستوى السنه التاسعه من التعليم، ومستوى السنه السادسه من التعليم ايضا امتحان وطني. اللي صار انه ثم تطبيق بروتوكول صحي، واحنا في تونس عندنا تجربه جديده انه البروتوكول الصحي كان تم انجازه بالتعاون مع وزاره الصحه، واللي يكون فيه كل الاحتياطات اللازمه لضمان سلامه التلاميذ واطار الاشراف وكافه العاملين بالمؤسسات، اللي هو مش شيء هين، على خاطر مش مستانسين بالاساس. الناس مش مستانسه انها تلبس الكمامه الواقيه، انها تغسل يدها اكثر من 5-6 مرات في اليوم، انها تغسل يدها باستعمال الجل، باستعمال المحلول الكحولي المطهر. هذه كل حاجات جديده. وهذا اللي خلى التلامذه يلقاو شويه صعوبه من الاول. لكن اللي تعبنا اكثر من الكل هو حكايه التباعد الجسدي، خاطر القاعات مبنيه على اساس القاعه فيها حجم نتاع 48-50 متر مربع، اللي في العاده ياخذ تقريبا 30-40 تلميذ. لكن كي رجعنا التلامذه عملنا تباعد جسدي انه القاعه ما تاخوش اكثر من 15 تلميذ. حتى في الامتحانات هذا مشينا اكثر من هكا، مشينا للقاعه مداخو كان 12 تلميذ، واذا قلنا 12 تلميذ في العاده كنا ناخذ 20 تلميذ في القاعه، يعني ان العدد نتاع القاعات انه كنا مجبرين انه نزيدوا تقريب الثلث من القاعات، ونزيدوا ثلث الاساتذه المراقبين للامتحانات. هذا كله باش نعملوا تباعد جسدي، والحمد لله لم نسجل اي حادثه، لم يسجل اي حاله نتاع مرض. لكن توا في الامتحان عملنا في البروتوكول الصحي بالنسبه للتلامذه اللي فيهم شك في الحاله الصحيه نتاعهم يتم عزلهم ويجريوا الامتحانات نتاعهم يجريوهم في قاعات مختصه. وبالنسبه للحالات المتاكده اللي وزاره الصحه تاكد اللي هما حاملين الفيروس، هذوما يتم نقلهم الى مركز حجر صحي، والامتحان نتاعهم يتم في مركز على حده، ومركز فيه الجانب الصحي اكثر من الكل. كما قلت ثم بروتوكول صحي دقيق، بروتوكول صحي اللي يأكد في كل حالة شنو هو العمل في حالة اللي نلقاو تلميذ مشكوك في صحته، شنو هو الحالة اللي نلقاو تلميذ مؤكدة إصابته بالفيروس، شنو هي الحالة إذا كان لقينا أستاذ أو معلم أو عامل عنده الإمكانية. هذا الكل فيه بروتوكول صحي دقيق. أنا حطيته لكم البروتوكول مع العرض، تلقوه إن شاء الله موجود البروتوكول الصحي. بالنسبة للرجوع إلى الدراسة، الرجوع إلى الدراسة باش يكون خلال شهر سبتمبر. خلال شهر سبتمبر عندنا نقص في البرامج نتاع الثلاثي الثالث اللي ما تمش، خاطر في تونس ثلاثي كامل لم يتم. كيفاش نجموا ندعموا التلامذة، كيفاش نجموا نحافظوا على مستوى التلامذة نتاعنا وضمان استمرارية التعلم وتواصله، خاصة اللي باش نبنيوا المستوى اللي فوق يلزمنا درجة تملك دنيا، درجة اللي باش نجموا نبنيوا عليها. هذا المتدخلة منها الأطراف تدريس أو كيف لإتمام المكتسبات نتاعهم مش موجودة كما قلت في كل الأماكن. هذايا خاطر جائحة كورونا مكنتنا أن نثبتوا اللي عندنا مشاكل في التعليم عن بعد. في الأصل متخيلين اللي التعليم عن بعد نتاعنا حاضر جاهز بريقل، لكن كي دخلنا في التجربة الأصلية لقينا اللي فما مشكل. وهذايا باش يمكننا أن نصلحوا أماكن الخلل اللي موجودة، وهذايا يلزموا إمكانيات. لكن في تونس عندنا مشكل صغير أنه الإمكانيات حاليا صعيبة شوية، الإمكانيات المادية صعيبة شوية. هذا علاش نعملوا برشا على الإطار التربوي، إطار الإشراف، أنه نعملوا على التدريس المباشر في خلال الرجوع، باش يكون ثم شهر كامل مخصص إلى استكمال حاجيات التلاميذ من المحاور اللازمة، خاصة اللي باش يواصلوا تعلماتهم في اختصاصات جديدة، خاصة اللي يتم توجيههم نحو شعب جديدة. مثلا التلميذ اللي ماشي للتقنية يلزم يتمم البرنامج نتاعو والمقررات نتاعو اللي تهم التقنية. اللي ماشي الشعبة علمية يلزم يتمم في العلوم الحياة والأرض. يعني ثم إمكانيات كبيرة، لكن في الأصل أنه كل التلاميذ يلزمهم يلقاو
دكتور حاتم 2 more minutes please.
حاضر. قريب أتممت محسوب. الحاجيات الحقيقية أنه التلامذة اللي باش يتحولوا من مرحلة إلى مرحلة، خاطر في بعض الحالات احنا نغيروا لغة التدريس في المرحلة الإعدادية للمرحلة الثانوية، كيف التلامذة اللي باش يتم توجيههم نحو شعاب مختلفة عن الشعاب اللي كانوا فيها. هذا يلزموا التحديات متاعنا هي كيف نوفر معناها اولا ساعة قبل كل شيء اللي كنا معملين عليه برشا هو ضمان عودة مدرسية آمنة بتوفير مستلزمات السلام. أول حاجة. ثاني حاجة هي اللجان المشتركة البيداغوجية للنظر في إمكانية ضمان استمرارية التعلم. بالطبيعة ثم عندنا أطراف اجتماعية اللي فاعلة في تونس، يلزمنا ننظروا مع الأطراف الاجتماعية كيفية أن الأطراف الاجتماعية هذم نجموا محاور الثلاثي بمراجعة نظام الدراسة، بمراجعة نظام العطل، خاطر ثم نظام العطل يلزم يتبدل. إذا كنا ناخذ عطلة متاع 15 يوم أو متاع شهر يلزم العطلة تتقلص. هذا الكل فيه برشا عمل، ثم لجان فنية قاعدة تعمل، وإن شاء الله نعطيكم الإمكانيات إذا كان ثم جديد نبعث لكم شنو هي الإمكانيات الجديدة. وشكرا.
You have to unmute me. Shukran, Dr. Hatem Amara. It's a very nice time keeping also, and thanks for your interesting points. So I'm sure now there will be question and answers, comments to be addressed to you, and I will switch over to our colleagues from UNRWA, Dr. Caroline Pontefract and Mrs. Frost David. So the floor is yours. We are running out of time a little bit, so but I will give you 20 minutes at least, if not half an hour, and then we'll have the break. And we aim after the break to finish up around 3 o'clock instead of 2:45. So please.
Okay, thank you very much. Thank you, and thank you for three really interesting and very different presentations. And we've been capturing the questions, which is not easy, by the way, with regard to the different formats, catching the questions and some specific questions. But I think we'd like to start, if you don't mind, by looking at all of you have talked about a holistic approach. All of you have talked about teachers, blended learning, psychosocial partnerships. So we thought would be really useful to hear from all of you, and I think our last presenter, thank you very much for that kind of level of reflection, is to ask you, all of you, what lessons learned that you really think you've taken from, say, the lockdown stage to go into either catch up or really crucially the back to school? To ask you that question because it picks up on lots of the sub questions. So what lessons learned have you taken from that will help you with regard to any other modality within this crisis? And one second part to that question, which kind of again links to the other questions, is with regard to resources. In terms of a resource restrained or constrained model, what thoughts do you have about that if it's not possible to double the amount of teachers in order to have social distancing? So 2 questions for all panelists, please. Lessons learned and thoughts about keeping the extra resources to a minimum. If we could perhaps start with our colleague from Jordan, who started, please, and then we'll go to the very specific questions with Frost in the next round. So please, our Jordan colleague, I think it's Yusuf, to please share with us any lessons that you learned that you'll take into your back to school phase and the resource implications. Jordan colleague. He's not there. Okay. Can I go to my Saudi colleague then, please, while we wait for our Jordan? Tahini, can you please share with us any thoughts about, as I said, lessons learned? Thank you. Thanks.
Unmute yourself.
Unmute, yes, please.
Unmute.
Tahani?
Dr. Tahani, please unmute yourself. Hello?
Sorry, yes, thank you.
Okay.
Okay, thank you. So lessons learned after this pandemic and its impact on education. So here comes first the good planning and better preparation for how to suspend the school and what other alternatives available to ensure the continuity and also support the schools' resilience and education resilience. So here comes after this all these consequences And after all these, the lessons learned, that we need to focus on the teachers. We need to focus on the educational environment, including the school, the student, the curriculum, and also provide support for the e-learning platforms, tools, and come up with the best models for education, to continue education, whether it's a blended education, whether it's a hybrid, and of course to be supported with field or pilot studies to what the consequences of this pandemic on education. So as I said in my presentation, the Ministry of Education has conducted 2 studies, and sorry if I'm taking others' time, but I say it again. They conducted 2 studies to evaluate the impact of the pandemic on education. They also supported the platform for online learning, distance education. They also are working on investing the 2 first weeks of the semester
please, mic's on mute apart from our speaker.
So to help students make up what they missed during the pandemic.
Thank you.
I just one thing.
Move on to the other people, please, because that's really great. Very articulate, and thank you. And as you said, both in terms of lessons learned from your own kind of insights, but also from actually doing some studies and gleaning from the studies. Hatem, can we ask you now, please? You did talk a lot about lessons learned. So I think if there's any particular lessons, or maybe for you to pick up on with regard to those resource constraints that you mentioned, how you will try to do the back to school within a resource constrained environment, which many of us, of course, are in. Thank you, Hatem. I can't hear Hatem.
Dr. Hatem, please unmute. Yes.
بالنسبة لتونس الموارد البشرية موجودة، هي المشكل الحقيقي هي الموارد المادية في التجهيزات. اللي صار في البانديمي هذه انه حتى المقاولين اللي باش يعملوا توسعات للمدارس ما قاموش بعملهم. هذا يجعلنا في ضيق، يعني اذا كان باش نعتمدوا عدد مقلص من التلاميذ، اذا كان نحبوا نرجعوا ثم مشكل صغير. صحيح بامكاننا الاعتماد على القاعات مسبقة الصنع، يعني البريفابريكي، لكن هذا ما يمنعش اللي فما مشكل حقيقي، خاصة إذا كان نحبوا نضمنوا التباعد الجسدي للتلاميذ. العودة خدمناها على أساس اللي هي عودة عادية، لكن في نفس الوقت نحضروا في الحلول إذا كان ثم تطور للوضع الصحي الوباء. أولاً الموضوع لنا احنا اللي أهم الكل هو كيفية استكمال البرامج اللي ما تمتش خلال السنة الدراسية. هذا فيه عمل الحقيقة، ثم تطوع كبير من المدرسين، ثم عمل كبير قاعد يصير من إطار الإشراف البيداغوجي. عندنا كما تعرفوا متفقدين وعندنا مرشدين بيداغوجيين إلى آخره، كلهم مستعدين للعمل هذا. لكن في الموضوع الكل الأهمية الكبرى والأولى هي الحفاظ على صحة الأبناء، هي الحفاظ على صحة الإنسان قبل العودة إلى الدراسة. وإذا كان ضمننا السلامة الجسدية البقية الكل تصلح، خاطر ما نعرفوش يمكن العام الجاي، يمكن السنة القادمة يكون ثم توقف للعمل اللي يكون 3 أو 6 أشهر، لكن هذا ما يمنعش اللي نمشيو ديما والأمل يحدونا للمساعدة. شكرا.
Exactly. Thank you very much. Thank you. I don't know if Dr. Yusuf came back online, our Jordan colleague. If not, maybe to move to Frost, who's got some of the very specific questions that were asked. Frost, over to you.
Okay, thank you everyone for the very rich presentations. We tried to capture the questions in the Q&A box, so I'm going to give a summary. Many of the questions were probably answered. There was a general probably reflection for all of us in this webinar to reflect on the issue of resource mobilization, especially donor countries are experiencing economic hardships due to COVID. There was some question with regards to teachers and the potential for teachers turnover or teacher retention going back to school. How do we mitigate this? How do we reach out to parents and ensure or give them the confidence that schools are safe for sending back their children? Something also to consider. Considering students with disabilities, the most marginalized students, how do we integrate them within our plans going forward? There's also the issue of how do we support teachers, especially with regards to the use of technology, for example. And there was a question with regards to reflecting on school risk assessments. Have these been done, and are there lessons learned in this regard? The issue of connectivity, especially in developing countries with limited resources. There were also specific questions to Dr. Tahani.
Can we ask, Frost, can we ask some of the questions, do you think? Which ones particularly to ask our panelists to respond? I don't know if our colleague from Jordan has come back yet.
Yes, there are also two questions, like this is the general questions that were probably for all panelists. And then there are specific questions, one for Dr. Tahani, which I think she answered in response to Dr. Caroline's question earlier about moving forward. What are the lessons learned from the experience you had so far? And there was a question specific to Jordan, to Dr. Youssef, about if there is a possibility to elaborate on the teacher training needs, because it was mentioned in the presentation that there's a plan to do teacher training. So that's it in terms of what was in the Q&A box.
I think from Jordan, our colleague didn't come back. I don't think, Dagmara.
Yeah.
So any of those particular issues, I mean, you've answered the questions that you want to pick up on, you know, particularly the issue of teacher and teacher support and teacher motivation that came through. Maybe to go to our colleague Tahani, sorry. Thank you, please.
Yes, so teachers are a very fundamental part of the learning or educational environment. They are very important. So for preparing teachers, it's very important to equip them with the skills, knowledge, and value of distance learning, and be able to be flexible for all teaching methodologies. For example, blended teaching or on our distance education, and how to manage students with all this social distancing format. We've heard about lots of stories about schools that teachers started with started handling the social distancing issue. So they're equipped with prepared how to mitigate this social distancing issue for students, and how to raise students' awareness to the importance of protecting themselves from the any consequences of this pandemic, and protect themselves.
Exactly, thank you. Hatam, maybe if you could say anything about disabilities, because Tunisia has got quite a good track record on supporting children with disabilities. Have you had any thoughts, or did you have any experience of working with children with disabilities during basically the lockdown, even though it was limited in Tunisia, and for going forward? Hatam, are you there? Yes, Hatam, please. Children with disabilities, any thoughts or experiences there with regard to providing education in these times? I think, are you on mute? I think.
شكرا. بالنسبة لتونس عندنا حاجيات الأطفال الخصوصية، خاصة للفاقدي البصر. فاقدي البصر لقينا اللي فما مشكل صحيح، مشكل اللي ما نجموش نخليهم. هذا علاش تم تجهيز المدارس نتاعهم بإمكانية التواصل عن بعد. لكن هذا غير ممكن باش نعطيه لكل تلميذ انه في بيته يمكن يتصل، خاطر ثم مشكل نتاع تجهيزات ومشكل نتاع ربط بالانترنت. وهذا علاش اعتمدنا التلفزه المدرسيه. لكن رغم هذا التلفزه المدرسيه بيدها كما قلت فيها مشكل. التلفزة المدرسية تعرف في الأماكن هذه ثم تلفزة واحدة في الدار تلقاها، في البيت تلقى تلفزة واحدة اللي مع الحجر الصحي الناس كل يستعملوا فيها خاصة للترفيه. هذا ما يخليش اللي التلميذ اللي يكون واحد من 6 ولا من 7 ما ينجمش ياخذ الوقت كامل نتاعو. على تحت أقصى مدة ينجم ياخذ ساعة ولا ساعتين في اليوم باش ينجم يستعمل التلفزة في وقت يمكن مش أحسن توقيت بالنسبة لي. بالنسبة للتلاميذ ذوي الحاجيات الخصوصية أيضا، بالنسبة اللي عندهم قصور نتاع عضوي أو إمكانية نتاع صعوبات في التعلم والتعليم، هذوما يلزمهم إمكانيات خصوصية اللي الحقيقة لقينا مشكل معاهم، اللي مش ديما متواجدة الإمكانيات والتجهيزات اللي باش تعاونهم في الموضوع هذا. هذا بالطبيعة يلزمنا حاجة خاصة للناس هذم، لكن الخصوصية يلزمها أيضا تجهيزات خصوصية ويلزمها أيضا إمكانيات خصوصية. شكرا.
Thank you. Thank you, Dagmar. I'm just wondering about the time. Are we out of time or should we ask one more question?
Yes, Caroline, thanks. We can go maybe 5 to 10 minutes maximum, and then we aim to go to a break. Yeah.
Because we particularly wanted to ask our colleague from Jordan about psychosocial support, which she was going to begin to talk about. But I wonder if we can ask our other 2 panelists about the whole issue of psychosocial support in these challenging times when, you know, one-to-one counselling is not possible, group counselling is not possible, I mean, face-to-face, and even the idea of bringing children together for recreational activities can be very challenging. And I wonder if you have considered this in the kind of lockdown period and with regard to going back to school. Perhaps if we could start again in the same order as we did last time, please. Tahini.
Yes, so social support is very important, and Ministry of Education already did that for students and for the whole educational community, and for teachers and also for parents. So during this hard time, so through the 20 channels and the education management system, they provided the full social support for students, and they are preparing plans for students when they come back to school.
Thank you. So through the television programs, it was in terms of psychosocial support. Was it direct psychosocial support? Was it just fun, entertainment, light relief? What, you know, how did you really kind of ensure it was supporting the children?
Yeah, actually, it was a very you know, fun and multimodal kind of content directed to the whole community members, all, you know, all stakeholders, to administrators, to parents, to teachers and the students, to give them all the full support, social support, and how to mitigate the impact of this pandemic on you know, community educational community members. And also they are preparing lots of plans for next year to even provide more social support for everyone.
Right, thank you very much. Hatem, about in Tunisia, the issue of psychosocial support when you can't, you know, give it or provide it in the normal way that you may do, you know, when schools are running fully. Any thoughts there, please?
في وزارة التربية في تونس تم تخصيص خطوط هاتفية هي موجودة على ذمة التلاميذ، موجودة على ذمة التلاميذ، وخطوط خضراء يعني يمكن أنه يتم مهادفتها بدون دفع مقابل. هذه موجودة على ذمة التلاميذ اللي في حاجة إلى دعم نفسي، وخاصة التلاميذ خاطر كما قلت في تونس خلينا الامتحانات جارية. توا مثلا عندنا امتحان البكالوريا قاعد صاير بداية من اليوم، صاروا امتحانات التاسعة والسادسة، وخلينا الخطوط مفتوحة للدعم النفسي لكل التلاميذ وخاصة تلاميذ ذوي الاحتياجات الخصوصية. هذايا سجلنا فيها عدد كبير من المكالمات قلت اذا كان ثم مشكل صغير في الخطوط في التواصل الاجتماعي يعني في الانترنت، لكن الهاتف الخطوط الهاتفيه موجوده على ذمه كل الناس. وهذا علاش انه ثم لقينا اللي بعض الحلول تعوض اخرى، وبالطريقه هذه عندنا تغطيه شامله بمختلف ادوات التواصل، بالهاتف او بالتلفزه او بالانترنت او الاتصال المباشر. يقعد هو الاصل في التعليم والتعلم، الاتصال المباشر ديما. وهذا علاش خلينا في كل مدرسه ثم امكانيه انه ثم ناس يكونوا متواجدين على ذمه التلامذه اللي يحبوا يجيوا للمدارس باش يسالوا او باش يطلبوا المعونه. وهذه حاجه خاصه رغم الحجر الصحي، كل مدرسه فيها 2 ولا 3 مدرسين موجودين. Voilà.
Thank you. Thank you very much. So thank you very much to both. I'm very sad that we lost our Jordan colleague, our presenter. But thank you.
I see Dr. Youssef online, but I don't know if he wants to say something.
Are you online, Youssef?
Or maybe it's his.
It's late now. I think you can't.
Okay.
I think we just have to say that was, I don't know what happened, but we say thank you very much. And we particularly appreciated that reflection with regard to the lessons learned and like taking those into anything that we face, whether it's lockdown, whether it's a blended approach to back to school or whether it's back to school. I think we really appreciated that level of reflection there and the kind of overall holistic, approach. So I think that, thank you very much. I would have liked to hear from Jordan about the devolution. I thought that was a very interesting idea about a model which goes down at different levels, maybe interpreted or contextualized. So maybe that's for another time, but to thank you very much for the 2 of you who remained. Thank you very much. And to hand back to Dagmara. Thank you. Dagmara, are you there? Thank you, Thiani and Hatton. Thank you.
Thank you. You're welcome.
Now we've lost Dagmara. Okay. Hello? Dagmara? The wonders of technology. Okay, maybe I'll ask another question.
Sorry,
Dagmara, are you there? Good.
We got disconnected. Sorry for this internet.
Back to you, please. Thank you very much. I'm really sorry that we didn't hear from Youssef, our Jordanian colleague, again.
Yeah, I'm sorry too, but we hope to get in touch with our Jordanian colleague and then make it up. And thanks, Caroline and Frost, for this very good facilitation. And thank you, Dr. Tahani and Dr. Hatem and our colleague, Dr. Youssef from Jordan for this very interesting session. Now we'll take a break of 15 minutes during which you will listen to some relaxing music, but please don't log off because then it may be difficult maybe to log on again. So please stay connected and we just come back. Now it's 1:05, we come back at 1:20 sharp. And I just want, before we leave, I just want to focus on like some key words that I captured during this first part of the webinar. I think from all speakers, what came out as one key word, key message is this collaborative approach in planning the back to school process. And our colleagues gave very good examples of how to integrate in this discussion, how to involve parents and teachers and families and communities, and how to plan in a collaborative way. The second key message was about roadmaps and flexible roadmaps, very comprehensive roadmaps, and that should be also operationalized. And those roadmaps should imply preparedness of different actors, of different partners in this process of school reopening. Then the third key message was about the importance of working together, like different ministries, Ministry of Health and Ministry of Education, but also other partners. The fourth key message was about support, about different types of support that is needed for teachers, but also students, support in terms of infrastructure and in terms of mobilizing resources. The fifth main, I think, key message was about communication. Okay, we want to go back to school and to plan for coming back to school, but how to communicate this process and how to make sure that the different perspectives of stakeholders and beneficiaries of education are taken into account. And then finally, and it's last but not least, the monitoring and evaluation aspect. And I was very happy to listen to the speakers talking about the ways that different indicators can be defined and taken into account and monitored throughout the process so that we can be sure we are on track and that whatever measures are put in place are producing results. So thank you very much for this first part. A 15 minutes break now until 1:20, and we'll listen to some nice relaxing music. Ellie. So see you in 15 minutes.
Okay, see you.
Yeah, dear colleagues, we should prepare to resume the webinar in like maybe 1 minute. Maybe you put the final countdown now to. We'll play the final countdown so that we get energized.
Thank you for the nice music, Dagmara.
Very nice, Dagmara.
Really nice.
Now, I can't talk for more than 2 seconds, but please, what's happening with the canteen email? Because Lucy sent it back to me, all the nice fonts on and everything. Yeah? Hello? Maria? No, but the email I got, he sent it back to me. I mean, I don't know, I've got 95 emails, and I'm too involved in this thing. But I just wondered why you sent back this site. I don't, it looks all ugly and things. If you send a message which is, really boring and dense, it also looks like. So what do we do? I don't want to.
Okay. Yes, dear colleagues, we will now resume the webinar and we'll launch the second part. I just want to check if Maria Tsvetkova, our colleague from World Food Program, is with us. Maria?
Yes, Dagmara.
Yes, okay, great. So I'm then handing over for this facilitation of the next session to our colleague from the World Food Program, Maria Tsvetkova, and I also ask kindly different colleagues to mute. Caroline, can you mute please your microphone? Yes, thank you.
Dagmara, sorry, it was my mistake. Apologies.
Okay, thank you. So I want to introduce Mrs. Maria Tsvetkova from World Food Program, our colleague and our partner in crime in organizing these interregional webinars, who will moderate this session, comprising experts, education experts, researchers, representatives of NGOs and of regional organizations, so that when talking about reopening schools and back to school processes, we gather a kind of comprehensive picture of issues, challenges, and also the perspectives of different partners and stakeholders. So Maria, over to you.
Thank you, Dagmara. Good afternoon, everybody. Now we will move indeed to our experts session, and looking forward to the insights that will be provided by them. We have a vast area of experts that are going to talk to us right now. Some of them from the think tanks, some of them from the international non-governmental organizations. To the speakers, please, we do have 10 or less minutes per presentation, and I will strictly try to enforce that. So do watch the time, please. So with that, and without further ado, I'll pass the floor on to the Save the Children. Emily and Melin, are you here?
Yes, hi.
Yes, thank you. The floor is yours.
Thank you. I'm just gonna share my presentation. So, can someone confirm that it's okay?
Yes.
Okay, perfect. Thank you, Bravite. So first, I just wanted to thank you, UNESCO, for creating these very interesting online spaces to discuss about this very important process. I'm Melin Schwarzberg. I'm education advisor at Save the Children. And today I'm going to present the interagency Safe Back to School Guide for practitioners. So for the one who doesn't know the guide was created to be a practitioner-friendly guide with concrete tools and activities to implement and to plan Safe Back to School with a really important focus on the participation of the community and on the inclusivity of the process. So this guide was built on the UN framework for reopening school, giving concrete action that be taken at the community and school level. So the idea of this guide was really to translate a little bit the global recommendation from the UN, the UNESCO guides, into very concrete and ground level activities. So we wrote this guide in a practitioner-friendly way, suggesting specific activities and action across the sectors of education, protection, wash, health, and nutrition. So as I say, this guide was designed for program teams on the ground, but also for coordination teams such as the child protection area of responsibility, the education cluster, the EIE working group, etc. But it's also a very interesting tools for collaboration and coordination with ministries. And we have now several examples of adaptation and contextualization through ministries. So for example, in other regions in Nepal and Philippines, but also now in the region, it's a process and job development in Iraq. As you can see on the slide, this guide was developed by the help of a lot of agencies and a lot of technical experts. And the guide was endorsed by both the global education clusters and the child protection area of responsibility. So on this slide, you have the three main points that we try to focus on during the development of the guides. First is the idea of integration. One of the primary objectives of the guide was to really highlight the need for an integrated and cross-sectoral response to ensure a safe back to school. We had the impression that COVID-19 has really highlighted how interconnected all sectors are, and that the safe back to school was an opportunity to work more efficiently. So even if education are sometimes are leading the process, we really try through this guide to give some practical guidance on how to be very integrated through other sectors, such as protection, health, nutrition, wash, etc. Then, as I said, this guide is really built on a specific technical quality through the help of a lot of experts from a lot of organizations and agencies. And we also really try to build on the critical lessons that have been learned from the Ebola responses. So also to clarify that this guide doesn't set any new standards, but was really drafted and developed through the UN framework and other guidance. And we're not creating something new, but really putting together the whole resources and information, qualitative information, and adapted it to the new situation of the COVID. Finally, we also try to put some emphasis on the idea of build back better. So we really thought that this process was a huge opportunity for all of us to do things better and to try to improve the inclusivity, the quality of the education sector, but also to reach children, for example, that have been reached or that children that are not in school before the crisis. Then you will find in this slide the principles that have been kind of guiding the development of the guide, and which we think should guide also the process of back to school. I'm sure you're very familiar with a lot of this principle, and I just wanted to flag her gender inclusion. So in the guide, we really wanted to make sure, and we tried as we could through gender specialists to give some orientation to make this process gender transformative. So you will find specific mention on how to include a gender perspective in the process. So now what you will find in the guide. So first you will find what we call the integrated checklist, which is a 6-page checklist, 3 pages for before school reopen, and 3 pages for before and 3 pages for once school are reopened. So in this 3 pages, we have the key action for each of the sector you can see on the slide. And for each sector, you have specific color, for example, education, I think is in green, protection in purple, etc. So for each sector, we have identified the minimum key action we want the sector taken to prepare a safe process of reopening school. So for example, here you have what looks like the checklists. As you can see, we really try to make this user-friendly and practical and operational with appropriate links to other resources. So for example, here you have the key activity, which is clean and disinfect school. And just after you have some indication on how to complete these activities with specific links to other guidance or other resources where relevant. Then the second thing you will find is the school-friendly checklist, which is a synthesis version of the 6 pages into just 2 pages. And now the audience, it's no longer a program or coordination teams, it's more toward head teachers and school management to use. So we really try to provide a tool for the school level to guide this process. And these school-friendly checklists include 3 parts, as you can see on the slide. First, it's a mini checklist that pull out the key action from each sector for the main checklists for school to complete before school open. Then we have the question to use with members of the whole school community to help to prepare for a safe return to school. And as I said, the idea of the guide is to really emphasize on the participation of the whole community. So you will find concrete action that can be taken to involve the whole school community. And finally, you will find key steps to take to support teachers, especially for the return to school. Then the last part of the guide are technical annexes, which summarize a little bit top-line guidance on the topic and also refer to a short list of created resources selected specifically for the COVID responses. As you can see on the slide, these technical annexes cover a lot of different subjects, and these technical annexes are one-pager or two-pager. So they are really, I'm going to just show an example before. So they are really, we really try to put the main points to be very user-friendly and practical for ground level. So you have here an example of the MHPSS for children as school reopen. And you will see there that we put the key message that parents and caregivers can do to support children. And then also a quick box of what children can do to preserve their own well-being. And again, there are links referred to other resources to more in-depth information. And just to finish, I'm gonna provide with you the learning of SCI's colleagues regarding the return to school process and the development of ministry guidelines to ensure the safety of this process, which has gone through a great deal of adaptation and contextualization of the guides. So this lesson learned come from Nepal, but also Iraq. First, the idea is to really have in mind that the guide is not, it's a guiding guide, is not an instruction, and it's really important that a contextualization are done at the ministerial level. Then it's the importance for national governments to decide what is non-negotiable, because we realize that sometimes there is some a kind of overlap between regional level, departmental level, and national level. So the ministry have really a big role to play to decide what is non-negotiable. Then the first point is the importance of the resources to implement the guidelines, which are key, because if we don't have resources to implement the guideline, it's quite difficult. And finally, the last point is the importance of coordination and collaboration between all actors, for example, the NGO, but also the national and governments. And for example, in Iraq, both the UN framework and the Safe Back to School guide were used as framework and guidance to develop a contextualized country-specific tool reopening framework, and it was done through the cluster. And just to also mention that if you want more information on the guide, the INE will launch a webinar in July with other participants around the back to school, and it will be in Arabic. Last points, the guide, it's now available in French, English, Spanish, and this month it will be available in Arabic. That's all.
Thank you, Melinda, very much for sticking to the time and for this insightful perspective on the guide, which is certainly very much in sync with the global guidelines that have been previously issued. Now I'll pass the floor to our next presenter, Dr. Jufi. The floor is yours for strictly 10 minutes. Thank you. We can't hear you, Dr. Jufi. Can you unmute yourself, please?
Okay. Can you hear me now?
Yes.
Yes. شكرا ماريا، شكرا دغمارا، شكرا لليونسكو ولشركاء العمل الموجودين الآن. وأنا الحقيقة سعيد جدا بأن نرى عدد من الشركاء لأن هذا هو الأساس في العمل. اليوم نلاحظ وجود أكثر من شريك موجودين، ومجموعة الدعم العربية تحتاج إلى دعم التعليم 2030، تحتاج إلى هذا التشاركية، تحتاج إلى هذا الشركاء الفاعلين في الميدان، لأنه دائما نقول بأن لدينا كثير من الأهداف وكثير من الطموحات، ولدينا كثير من التحديات التي لا يمكن اطلاقا ان نواجهها بدون العمل المشترك وبدون الجهد المشترك وبدون التكامليه بين المؤسسات العامله في مجال التعليم في المنطقه العربيه. اختصارا للوقت اقول على انه نحن نعلم تماما على ان اهداف التنميه الانمائيه 17 وخاصه تلك الاهداف المتعلقه في المهارات المنطقه العربيه ربما لن تحققها اطلاقا، وهذا ناتج يعني من قراءات التقارير الاو سي دي، تقارير مجموعه العمل الدوليه، تقارير اليونيسيف، تقارير منظمه العمل الدوليه، وكل التقارير توحي لنا بان هناك مخاطر ما لم نعمل بشكل اكبر، ما لم نعمل بشكل جدي، هذا قبل كورونا، فان الاهداف المتعلقه بالمهارات ربما لن يتم تحقيقها في المنطقه العربيه، وايضا على نطاق واسع ربما في غير المنطقه العربيه، لكن نحن نركز على المنطقه العربيه، وعليه هذا يقودنا الى ان التعليم بمؤشراته 42 بالغايات العشر ربما ايضا ان كثير من الدول العربيه لن تحققها، وربما لا نريد ان نقع مثل ما حدث في التعليم للجميع. وجدنا في تقرير اليونسكو الصادر عن اليونسكو بيروت على المنطقة العربية بأن جميع الدول العربية لم تحقق جميع الأهداف، أي أن الأهداف التي كانت موضوع الأهداف الستة للتعليم للجميع لا يوجد دولة عربية حققتها جميعا. اليوم نحن نكرر نفس العمل ونفس الإشكالية ونفس المخاطر. هناك الآن وخاصة اليوم عندنا أزمات، عندنا دول عربية 5 دول عربية تعاني من أزمات، عندنا أيضا أزمة كورونا التي غطت على مجمل العمل التربوي والتعليمي ومنظومة العمل بشكل كامل، وبالتالي هناك مخاطر حقيقية في هذا المجال. أنتقل إلى التأثير أولا قبل أن أتكلم على اللي هو موضوع كورونا. يعني تأثير الحقيقة احنا مرت الأزمة أو مرينا بمرحلة سميناها مرحلة الصدمة. في مرحلة الصدمة اللي في بداية كورونا جميع الناس كانوا منشغلين في موضوع الصحة، في موضوع التأثير الصحي، في موضوع الحياة والموت، وهذا أدى أيضا إلى تأثيرات نفسية مش فقط على الأطفال لكن على الأطفال والمعلمين وأولياء الأمور. أيضا الدول إجمالا تعاونت معها كردة فعل سريعة. بعض الدول عملت ردود فعل يعني جيدة، بعضها كانت مترددة، بعضها لم تكن هناك أي ردة فعل، نتيجة أنه هناك أولويات لدى الدول وهي قضية الصحة وقضية الاقتصاد وقضية الإغلاق، وكان هناك أيضا تحدي كبير جدا. هذا الحقيقة أدى إلى أنه في العام الماضي، ما أدري الشريحة واضحة؟
يس.
نعم. هذا ادى الى انه يعني هناك مخاطر في العمليه التربويه التعليميه. اولا لم يعد التعليم ذات اهميه عند المخططين الاقتصاديين وعند صناع القرار، نتيجه ان هناك اولويه هي الصحه، وايضا نتيجه ايضا الاقتصاد ونتيجه الازمه الاقتصاديه اصبح التعليم ايضا ستتاثر ميزانيته، وبالتالي هذا ادى في المرحله الاولى الى التسرب، الى قله الوصول، الى هناك تساؤلات كبيره حول التعليم، وايضا التقييم. تفاوتت الدول العربيه اجمالا في موضوع التقييم، هناك من قاموا بعمليه التقييم الالكتروني، وهناك من عملوا تقييم من الغي التقييم تماما واعتمد على نتائج الصف الاول الصفوف السابقه، وهناك من اعتمد على نتائج الفصل الاول الفصل الدراسي، وهناك من لم يقم باي عمل مثل هذا القبيل. وبالتالي هنا اشكاليه حقيقيه، بما معنى انه قياسنا للعمليه التربويه والتعليميه لم يكن بمستوى الجوده المطلوبه، وهو تفاوت. وانا بتكلم عندما اتحدث بصفه العموم ولا اتحدث بصفه الخصوص. هناك تمايز بين الدول، هناك دول عملت بشكل كبير، مثلا عندما نلاحظ مثلا زي المملكه العربيه السعوديه كان لديها 24 قناه، هناك دول لم يكن لديها اي قناه تعليميه، هناك دول كان لديها ايضا بلاتفورمز متعدده، هناك دول لم يكن لديها اي بلاتفورم، لكن انا اتكلم على الدول العربيه. ايضا هذا ادى الى مشكله الفقر، تفاقم مشكله الفقر. وماريا مسؤوله ايضا على التغذيه، تعرف تماما على ان كثير من الطلاب والطالبات في عدد من البلدان العربيه يعني يعتبر التغذيه المدرسيه اللي تقدم لهم او المعونات الاجتماعيه اساسيه بالنسبه لهم، قطعت نتيجه عدم وجودهم في المدرسه. اذا هذا سيؤدي الى تفاقم المشكله الاقتصاديه، ويؤدي ايضا الى مشكله اخرى هي يعني معناته التسرب في التعليم سوف يكون اكثر، وصول التعليم اقل، جوده التعليم اقل، تقييم غير مدروس ولا نعلم على مستوى جودته. احنا الان اعتقد انه احنا الان سننتقل الى مرحله جديده هي مرحله التكيف. هذه المرحله اللي بنتكلم عليها الان اللي هي من الان وصاعد. من الان وصاعد الحقيقه هناك تحديات عندما نتكلم على فتح المدارس، هناك تحديات تتجمع. صحيح دول كان عندها امكانيات واشتغلت بشكل معقول، وخاصه دول الخليج العربي نتيجه الامكانيات ونتيجه البنيه التحتيه ونتيجه ايضا الوفره الماليه عملوا بشكل جيد، وكان هناك يعني عمل جيد، لكن كانت هي عباره عن ردود افعال. المنهج الذي يقدم لطلبتنا في الازمه اثناء الازمه كان هو عباره عن نفس المنهج، لم يحدث له اي موائمه. طريقه التقديم كانت تقديم مستعجله، وبالتالي المعلمين لم ياخذوا اي تاهيل لبناء مواد. كان هناك مبادرات جيده لكنها لم تكن تؤدي الى نضج العمليه. اليوم ونحن نتكلم على سبيل التعليم لابد ان نتفكر بامعان. ان كان القرار هو العوده الى المدارس، هل العوده ستكون العوده الى المدارس بنفس الكيفيات مع التباعد الاجتماعي؟ اذا سيكون عندنا مشكله عدد الفصول الدراسيه المتوفره، عدد المعلمين المؤهلين، وماذا عن الوقت؟ وبالتالي وماذا ايضا عن الصفوف الاولى وذوي الاحتياجات الخاصه؟ ايضا هذه مشكله اخرى يعني نعاني منها، وبالتالي لابد ان ونحن نفكر بالاستمراريه لابد ان نفكر، ونحن نفكر بالبدائل لابد ان نفكر ايضا بالمعضلات والتحديات القائمه. نحن نعتقد بان هذه المرحله مرحله اللي هو مرحله التكيف اللي نسميها مرحله التكيف اللي فيها يتم استمراريه العمل. اداره استمراريه العمل لابد ان تركز على 4 قضايا اللي هو منع التسرب، مرحله العمل، تاهيل المعلمين، وفي نفس الوقت مره اخرى كل هذا لا يمكن ان يتم بدون تمويل. وهنا تاتي اشكاليه التمويلات الدوليه، وكثير من الدول العربيه تعتمد على التمويلات الدوليه، وكثير منها ايضا عندها التمويلات الخاصه، لكن ايضا اقتصاديه التعليم تعلمنا ايضا ان القطاع الخاص هناك اشكاليه، هناك معلمين تاثروا اثناء الجائحه وخاصه في المدارس الاهليه والخاصه لم يستلموا مرتباتهم او ان هناك استقطاع مرتباتهم، وبالتالي سيؤدي هذا الى اشكاليه حقيقيه في قضيه اللي هو اقتصاديه التعليم. ولابد ان ننظر الى الموضوع بنظره شموليه وليس فقط مرتبات واجور، ولكن الامكانات المتاحه والتي تقدم لقطاع التعليم لابد ان تكون هناك كافيه. اذا لابد من اعاده هندسه العلاقات، لابد من اعاده هندسه التمويل، المؤسسات الدوليه والمؤسسات الداعمه، وانا اعتقد ان اليونسكو ومجموعه العمل الموجوده اللي مشاركه يمكن ان يكون لها تاثير على البنك الدولي وعلى المؤسسه المانحه باعاده هندسه التمويلات القائمه للبلدان. وعلى وجه الخصوص للتعليم لا يمكن اطلاقا ان نستمر مثل ما كنا، لابد ان نتحدث عن البدائل، وخاصه ما يتعلق بدعم المعلمين وتاهيلهم ومرحله العمل والبدائل المختاره. هل سنتحول الى تعليم مدمج؟ هل سيكون تعليم الكتروني؟ هل سيكون بما معنى انه نحن نتكلم على منظومه جديده من التعليم. اذا ونحن نتكلم على هذا انا اعتقد انه هناك الحقيقه انا كنت اتتبع الاسبوع الماضي قرارات الدول. هناك دول تعتقد بانها ستذهب الى التعليم المدمج، هناك دول تتكلم على انه الفصل الاول ربما يكون عباره عن تعليم عن بعد. اذا ونحن نتكلم على هذا ماذا اعدينا؟ هل تم موائمه المناهج؟ هل اصبحت المناهج وفق اليات جديده تتعامل مع التكنولوجيا؟ التكنولوجيا ليست هدف، التكنولوجيا ليست غايه، التكنولوجيا عباره عن وسيله، ولكن هذه الوسيله تحتاج الى مدعمات، تحتاج الى ادوات. الادوات هذه هي المنهج هي المنهج الموائم، هي المعلم المؤهل، هي الاساليب المقدمه، هي اليات التقديم، هي ايضا اليه التقييم، لانه ايضا تعليم بدون تقييم لا يمكن ان نتحدث عنه. لابد ان نعرف ما هي اليات التقييم لابنائنا وبناتنا، لابد ان نتكلم بان هذه الاليات مناسبه وملائمه وعادله، لابد ان نتكلم ايضا على تكافؤ الفرص، ونتحدث ايضا على ابنائنا وبناتنا اللي هو ذو الاحتياجات الخاصه، وايضا في المراحل الاولى وخاصه ما قبل المدرسه. نحن في الاهداف 2030 نتكلم على انه لابد ان يكون هناك 50% في حلول 2030 من الاطفال ما قبل السادسه قد تلقوا تعليم على الاقل سنه واحده. هل سنتمكن من هذا؟ هل بهذه الاليات كيف سنصل اليهم؟ ما هي الاليات التي ستتعامل معهم؟ هذا سؤال كبير، وانا اعتقد انه هو هذا سؤال مفتاح. ايضا ذوي الاحتياجات الخاصه، دول الازمات، اليوم دول الازمات تعاني من ازمتين وليس من ازمه انها دول ازمات، وازمه لانها تعيش في كورونا. يعني وبالتالي يعني عمليه معقده جدا جدا. بعد المرحله دي انا اعتقد ان احنا سننتقل الى مرحله ثانيه، وهي مرحله اللي هو مرحله التعافي. بعد مرحله التعافي دي يمكن تكون في الفصل الدراسي الثاني، يمكن تكون العام القادم، لكن هي لابد ان يكون هناك اليات لعمليه التحول، لانه المنظومه التعليميه ستتغير، فلسفه التعليم تغيرت، نظره للتعليم تغيرت، وهذه النظره الايجابيه الحقيقه. هناك نظره ايجابيه بان كورونا وعمل كورونا قد ادى الى تغيير في مفهوم الناس للعمليه التعليميه وطريقه تقديمها، بما معنى لن يكون تقديم التعليم لن يعود مثل ما كان نهائيا، لن يصبح تعليم تقليدي، لكنه ستتحول ادواته، ستتحول الياته، وهذا التحول يحتاج الى اداره، يحتاج الى نظم، يحتاج الى حوكمه، يحتاج اخلاقيات العمل الالكتروني والتكنولوجيا واستخدامها والمنظومات المختلفه. وين هي؟ هل احنا عملنا على عمل مودلز وعمل ايضا فريم وركس اللي هو اطارات لاداره هذا التحول، انشاء المنظومات الجديده المتعلقه بالعمليه التربويه والتعليميه التي تتعامل مع هذا الموارد ايضا مره ثانيه ومره ثالثه من البدايه، لانها تصبح الموارد هي مهم جدا. منظمه الغذاء العالمي تحتاج الى موارد، التعليم يحتاج الى موارد.
دكتور جوفي
اوكي
1 minute sorry.
عموما نحن في مكتب التربيه العربيه لدول الخليج حاولنا بقدر الامكان ان نتعامل مع هذا بجزء من البراغماتيه، لانه نحن ليس لنا سلطه على الوزارات، لكن جمعنا وكلاء الوزارات، تحدثوا وكلاء وزارات في مكتب التربيه الاعضاء في دول الخليج العربي ماذا عملوا وماذا ينوون ان يعملوا. جمعنا ايضا الوزراء، تكلم الوزراء على خططهم وبرامجهم. نحن الان نعد الى لقاءات اخرى، لقاءات هذه مكثفه ما بين الوزراء لكي نستفيد فيما بيننا البين. نعلم تماما ان هناك بلاتفورم موجوده في بعض الدول بامكاننا نستفيد منها بشكل اخر. نريد ان نحدث تكامل بين دول الخليج حتى تستفيد الدول مما لديها. هناك تجارب متميزه، هناك مبادرات جيده، لكن كيف نستفيد منها؟ كيف نوظفها؟ كيف نعمل عمليه التكامل؟ كيف نبني؟ كيف نطور؟ هذه تحتاج الى قياده التحول، وانا اعتقد ان اليونسكو لابد ان تلعب دور في هذا المجال. شكرا جزيلا لكم.
Thank you very much, Dr. Aljufi, for this perspective. Very truly said, it's a changing world and it's no longer the same. Now I would like to pass the floor to the next presenter, to Ms. Karma, who just disappeared off my screen. Ms. Karma from AUB, are you here? Yes. Can you please unmute yourself, Ms. Karma? You have 10 minutes.
Yeah, I'm here, and it's great to be in this webinar and to listen to all of these interesting experiences, very enriching and very informative. I'm going to talk about something which is a little bit different, and I'm going to really share with you the student experience that we, like all the schools and the universities, we turned into online teaching during the spring term, and it was very important for us to evaluate that experience after we did it. So in end of February, early March, we had to stop face-to-face teaching and adopted an online teaching strategy and to start implementing it. Really, the situation took us by surprise. We were not really at all prepared for it. However, with the support of administration and IT, we all embarked on online teaching. It was really a very, it was a learning experience for us as faculty, students, and for the administration. And at the end of spring, we wanted to evaluate students' learning experience. Did they learn? What were the challenges? And so on. And so we developed a student learning experience questionnaire. We developed it and administered it to all the courses. The students' response rate was really very good, 83%, and we received 37,000 responses. I'm going to spend some time and tell you about the questionnaire we used, because this questionnaire highlights the main dimensions that are really evaluated when we are talking about online teaching. The questionnaire had 4 sections. In section A, we had some items on traditional teaching, because in the spring term we had 1 month only of traditional teaching, and we wanted to evaluate it. In section P, we went on, we had 23 items covering teaching, the online teaching experience. And it focused on 6 main dimensions. First, we wanted to see how well our instructors were prepared for online teaching in terms of timely response to student queries. Did they hold classroom discussions? Did they provide feedback and guidance? Then we had to evaluate the online material, because it's very important in online teaching. Was there ease of access to it? What's the quality of the online material? How well organized? How appropriate to the level? You know, how easy to navigate? And does it really address the different learning styles and the different cognitive levels? And then we had to evaluate the learning activities, you know, the group work, the individual work. Did it encourage interaction with the instructor, with other students? Was there a sharing of ideas? Was there a student engagement? And was the course found interesting? Because, you know, we know that when students are engaged and motivated, they are more likely to learn and to have good outcomes. And then we wanted to evaluate the online support, how well was it provided, the online tools, was there a variety of tools, were they helpful, and so on. And lastly, we wanted to see the workload. Was it manageable, or was it overwhelming to students? So these were the dimensions that we included in the questionnaire. We also had a section on the various tools. You know, this is a listing of the various tools that our students were exposed to, and many of these have been mentioned in the presentations in the morning. And then we had a section on learning outcomes. Did the students learn? How well did they learn? And then we had a 4th section, which is about the comments. We asked them about the challenges they face and the issues and how can they be improved. Now I'm going to share with you some of the results that we found. The results were analyzed quantitatively and qualitatively, the comments, because the students really wrote and provided a lot of comments. And then we analyzed them for the whole university, and then by faculty, by department, and by class level, to see, you know, at which level the challenges were mostly felt, or in which major, and so on. And of course, the information, the results was shared with the IT in order to improve, and with faculties. The items that really had the highest scores on the questionnaire was that the access, they were able to access the material. The material was well evaluated. It was organized, easy to follow. It was appropriate to the level. And then there were some questions about the instructor response and his raising discussions in the classrooms. These were the highest items, and they were so students were satisfied with them. So ease of access, quality of online material, and instructor readiness. Now the weaknesses was that there was really, the students felt that they could not share their ideas. There was less engagement in the classroom, less discussion, and accordingly they found the classes less interesting. And the online classrooms could not really, were not tailored to different learning styles or cognitive styles, and so on. And there were some questions raised about technical support. With respect to the tools, the most popular ones, or the ones which were found more useful, the Zoom, they were able to access it and to work with it. Voice over PowerPoint was also highly rated, and the assignments and Moodle. The ones they had really challenges with were the Adobe, the Google Classroom, Team, virtual labs, and quizzes on Moodle were really the areas of weakness or challenging areas. As I told you, the comments were really, the students provided extensive comments and answers to 4 open-ended questions. We really had around 1,000 pages of comments, and we had to use a software. We used the NVivo to really analyze the comments and derive the main themes and the main issues. I grouped them into themes, and of course, the main challenge was connectivity. Basically internet connection, connectivity, electricity cuts, and there were technical issues. We know that not all students had internet or good internet connection. They didn't have the tools, they didn't have tablets, they didn't have PCs or laptops at home. There were, so that was a main challenge for many. Many could not attend the sessions when they were held, and they had to really just attend a recording later on, and there was no chance of asking questions or interacting. Another main issue was the assessment. The assessments were, in many of the assessment we used timed assessment. We would give open book, open notes kind of assessment, and but we restricted the time, and so the students found the time was limited. The type of assessment, the content, the content, frequency of testing. There was the issue of cheating, unclear grading criteria, and they couldn't seek possible assistance from the instructor during the exam. So assessment was a major issue for students. Another important issue was the online content of it and the student level of understanding. Some concepts students found difficulty in understanding through video, and it really they expressed their opinion that it took longer to learn from online lessons than face-to-face lessons. And many they said that they had to resort to YouTube to gain a better understanding of concepts being taught, or they had to rely on self-learning. Posting lectures with voice-over recording online with no further resources to students turned out to be not very useful. They needed extra resources. Another major challenge voiced by students was the workload and the pace of the course. Some said that it was really unmanageable, especially with the situation that the students were going through. They were overwhelmed with assignments and papers, and the pace, they mentioned, this is a quotation, was not well adjusted to the current situation they were in. The deadlines were not clear, and there was overlap with other courses. Everybody had to finish the syllabus, and there were too many assignments, and they were not really properly scheduled. Another major issue, which also was mentioned this morning, was the communication. Communication was lagging, maybe because the students were sending emails, they were not getting prompt response to them from their professors, or maybe because there was limited feedback on their assignments and on their quizzes. And maybe in some instances, the feedback given was not appropriate for the course, especially in design and lab courses. These had really issues. The design and the lab courses and the workshops, the feedback was not really enough and was not appropriate. And of course, group work was not managed well under an online instruction. So that was all part of the communication. The platforms used, also students and faculty, they were unfamiliar with them, and they needed training on them, and so they needed the technical skills. So that was an issue, how they managed the platforms. And finally, many of them mentioned the psychosocial well-being. There were issues raised with respect to the students' psychosocial well-being. The current situation they were experiencing, the lockdown, and the pressure from the studies and so on, and the socioeconomic situation in the country, the students expressed that they were stressed and anxious to the workload and to the situation, and this led them to low concentration and low motivation to work. So these were the main challenges which were faced using online teaching in our spring experience. And as a conclusion, and recommendation. You know, we took all of these findings and these results, and we were making use of them to try to improve the fall term and the fall administration. And so we are working on continuous training of the faculty on students, especially on the platforms that they found that were challenging. We're really focusing on ensuring the use of more valid and reliable assessments, and that their students receive clear grading criteria, and that they are always provided with continuous feedback on their work. Then we're also working on better scheduling of the assignments and the quizzes in order not to overwhelm students and to make the work manageable. We are really working on promoting tools and instructional design. You know, nobody was trained to design courses for online courses, none of us. And really, designing a course for online teaching is different from a traditional teaching. So now we're working on really training our faculty on instructional design for online courses that will enhance discussion, group work, communication, and student engagement, because these are some of the main points that students refer to. We are less engaged, there are less discussions, less group work, and less sharing of our ideas. We are also recommending that the presentations are supplemented with additional material, additional examples, additional reading, because students have complained that voice-over presentations is not always helpful. With complex concepts, you need more for the students to understand. Definitely, we need to work on improving psychosocial well-being of students, better understand the situation, and try to reduce their anxiety level and keep their motivation high. And finally, the connectivity and electricity issues are really beyond us and beyond our pedagogical scope, but really we should take them into consideration as faculty members and instructors. And when we are giving assignments and dealing with the students, we know that maybe students are not able to attend on time, or they are not hearing well, and so on. And we should try to compensate for this lack of this connectivity by other modes. Thank you so much.
Thank you very much, Dr. Karma, for this exciting perspective from Lebanon experience.
Thank you.
Now I will pass on to the colleagues from Norwegian Refugee Council. Can you please unmute yourself, and you have the floor for 10 minutes, please.
So good afternoon, everybody, and thank you very much for giving us this opportunity. It's great to be with UNESCO colleagues and so many other colleagues from across the region. This afternoon, our presentation is going to be focused on PSS and SEL. However, just to sort of summarize somehow from all the many excellent presentations that have been made so far, what we have said is that we've got foundations, priorities that we base all of our programming on in the region. So when we look at these 5 points, and these are things that have all been mentioned today, things that are important to us and the great colleagues we have in the field doing all of our work every single day with great communities. So first of all, the importance of coordinating has been mentioned also by our Save the Children colleagues with the guidelines, making sure that we reflect national guidelines, that we work together with ministries. Ensuring that we collaborate when we're doing our school reopenings. Of course, we have many colleagues we need to work with, particularly our colleagues in water, sanitation and health. Ensuring inclusivity, not only in the sense of talking about people, children and youth with disabilities, but also particularly youth. I think sometimes in our plans we can get very, very focused on children and aiming our messaging at children, but sometimes forgetting that if we really want young people to stay connected with their learning, we need to make sure that our communication, our PSS and our learning opportunities also reflect messaging that's suitable for the adolescent and youth age group so that they stay engaged in learning and stay engaged in their learning pathway. We want to be flexible. We need to work together really hard with donors to make sure that we can reprogram and we can ensure that we have responsive activities and programming that we're doing both in formal education and non-formal education. And finally, continuing to work together with the great communities that we have the pleasure of working with the learners within those communities, but most importantly, making sure that we don't forget that for all the children and youth who before this crisis began had not yet found the front door, how do we continue to make sure that we look for them and that we ensure that somehow we find a way to reconnect them with their learning pathway? So now I'm going to hand over to my colleague Camilla, who's going to go into more detail about the PSS approach that we use in NRC across the region. Thanks very much.
Thank you, Therese. And I hope everyone is still there and being active into these webinars where a lot of information is shared. Let me just explain the PSS cell social emotional learning approach that NRC uses through what we call the Better Learning Program. The Better Learning Program was started in 2011 in Gaza in a very few number of schools, in 8 schools in UNRWA, and since then has developed further in a lot of countries across the globe. It is based on the 5 principles for recovery, known as the ones that you see on the slide: being able to calm down, having a sense of safety and stability, having the power to change the situation, connecting with others, and reestablishing hope. If you think about a very easy way of summarizing the different stages of BOP, think about the traffic lights. You have the green lights, the yellow and the red. So the green is the easy one, general classroom-based approach, targeted for all children and young people in any stage of emergency. Number 2 is zooming in for a smaller group intervention for children who are academic underachievers due to stress and crisis. And the number 3 is the more specialized approach to address trauma-induced nightmares throughout the individual and group session. This program was established together with the University of Tromsø. And during this period of COVID-19, we had to be creative, as many of you also, I'm sure, would have found themselves in a situation, how to promote remote learning and how to create resources that are supporting children, teachers, and parents. And so this is just a very packed slide with different apps that we used, flyers with PSS messages. We created groups of master trainers and peer support, videos that were broadcasted from Mehe in Lebanon, and a lot. Now, what is interesting is that the University of Tromsø and NRC developed a response brief with approaches on how to use the Better Learning Program during this period. Now, going back to school, some of those resources we will still use and will still support the going back to school. And we wanted to focus very much on the 3 categories of teachers, parents, and students. So teachers, there will be self-care sessions that will be carried out once back in school, setting up of peer network practices with trained staff, and applying the psychological first aid kit. For parents, similarly, there will be awareness sessions on the well-being and the Better Learning Program, how to support children, how to also focus on our own well-being, and providing supporting the supporters support needed. So through a well-being network of peer-to-peer parents that will be set up. Now, in the latest survey that was carried out in the region on well-being for 1,450 children in the last couple of weeks, we found out that 84% of the children had increased stress level due to COVID-19. Now, what to do with children when they go back to school, and how to continue working in helping them, supporting to feel supported, feel free to share the range of emotions, feel free to being safe. So basically, through the programs I just mentioned, we will be reinforcing the capacity building of teachers through simple techniques to help focus, concentrate, and release stress. Now, all this is done, of course, in collaboration with Ministry of Education, and it is to mention that here in the region, in 3 countries, namely Lebanon, Palestine, and Jordan, there are ongoing discussions and formal agreements to mainstream this program across formal schools. And this brings me to our last slide. To know more, of course, we have these contacts, and I hope that the information was fast and not over the minutes that were allowed. Thank you very much for inviting us, and over to you, Maria.
Thank you very much, NRC colleagues, for this very interesting and insightful presentation. That concludes this round of presentations. I think we stuck to the time, more or less, Dagmara, I hope. And I'll pass it on over to Dagmara.
Yes, thank you very much, colleagues and Maria, for facilitating this session. I think, again, we gathered a lot of insight in different areas of challenges and also possible responses with regard to school reopening. A lot of open questions, but I think these open questions are very important to keep us thinking and keep us deliberating with regard to what has been done, what works, what not, what has to change, and so on. So again, I heard as key messages this issue of looking into feedback, because now a lot of measures have been put in place, but we need to place more emphasis on feedback. And I liked a lot this what was said about hope, because I think all what we do is meant to re-establish a kind of positive attitude of all of us, and to give us hope that there is a future that can be managed. And I think this is also one big message, one big also mission of the school reopening process. So Caroline and Frost, over to you for the question and answer session.
Okay, thank you very much. Thank you, Dagmara. Thank you to our 4 panelists. And as you said there, thank you, NRC, for helping us with pointing out the commonality, the common strands, which Dagmara has also just built on, between what might have looked like 4 very different presentations, but those common strands. And I think the last one, which was particularly relevant to everyone, was reconceptualizing what we do. You know, it's not that we do something completely different, but we have to think about it in a different way for this type of crisis. So what we wanted to do was actually start, to go through. We've got some questions from, obviously, from the Q&A, and to start in the order of the presenters, near enough, actually, because first of all to Emily, and then to Karma, and then to Abdul Rahman, and then to our colleagues in NRC. So with regard to Emily and Save the Children and the checklist, we just wondered on reflection, what do you think the challenges countries might face in trying to implement the checklist or adhering to the checklist, and what role, if any, could you see as partners or the other sectors in the country, other ministries, could play in supporting the implementation or the following of this checklist? Thank you, Emily.
Thank you a lot for the question. So as I said on the last slide around Nepal and Iraq, what we saw was that one of the main challenge is the resources, because it's very interesting and very important to develop the checklist, but then you will need some resources to implement the concrete action put on the checklists. Then one of the challenge is also the coordination between all sectors, And I think, yes, all panelists really try to emphasize on these points. But when I say coordination between all sectors, it's also between all actors and also all levels. For example, as I said, sometimes it's quite challenging to work between regional and national level. So yes. And
is there any specific role for partners? You know, as many of us are here.
Yes,
in
so
helping with that coordination. Thank you.
Yeah, thank you. So I think partners have two main roles. First, they have to advocate and to have, yes, an advocacy role to support ministry, to try to put into practice and to contextualize the guidelines. So, for example, the UNESCO framework, but also the guide for practitioners. And so they have to advocate and then to support on the implementation of the guide. And I think these supports have to be coordinated, for example, in emergency context through the EIE working group, but also in development context through the working group of education and other sectors. So the two main roles, to my mind, I think, and what we saw from the experience, is to advocate and then to support on the ground the ministries.
That's great. Thank you very much.
Hi, just one more addition to that. This is Emily Dirk and Milline's colleague. I think COVID-19 has really highlighted the fact that we need to be much more local in all of our education initiatives. We can't rely on the old surge models of flying people in all over the world. Our local partners, our local agencies are and will always be the first responders. So how can we support them in the best way? And I think highlighting that in Milline's conversations about coordination is essential. And when we say about putting resources, it's not just the technical resources. How do we support the organizational capacity of local partners to do what they do best and how they know it?
That's really helpful. Thank you very much. Thank you. So now Frost is going to ask a question from the actual question and answer screen to Dr. Karma. Thank you.
Hi, so thank you for all the panelists. And for Dr. Karma, there were some specific questions in the Q&A box. Read to you. First, the survey is from a student's perspective. What actions were put in place to get the perspective of the instructors and professors? Second, were there any guidelines for the instructors on preparation of materials before starting the work? And third, if you can elaborate on who were the students that you conducted the survey with? Thank you.
Thank you. The students were all students who were enrolled at AUB in the spring term. And we sent it to all the students online, and we got 37,000 responses because, you know, every student has to evaluate every course and every instructor. So that's why we have so many responses. It was a very good response rate. The faculty members really, it was a sudden move and we didn't have any training. We had to really embark on online teaching. Of course, we got IT support and support of the administration, and we were provided with, you know, online training on the spot. But we didn't get and guidelines and different tools to use and so on, and IT helped 24 hours, but it was just on the spot, and we had to do with that, you know. And that's why I said it's a learning experience. We learned as we continued teaching. We did mistakes and we maybe sometimes we blundered, but we learned, and by the end of this term we became more proficient. The same with students. No training was provided to students, only support and help, and you know, but it's quicker for them to learn than for us as faculty, you know. Especially if you've been trained to teach as a traditional teacher. And as I mentioned before, the design for an online course is totally different. And we had to really revisit our curriculum and the way we're teaching in order to make it more fit for the online kind of setting. And the last question is, we did not get the chance to get faculty perspectives on their term. We are going to do that at the beginning of the fall term. They really had a lot in front of them, the faculty, to manage their courses and the assignments and the scoring and to train themselves. So we didn't get their perspective, but we shared with them, you know, each faculty member received his own evaluation for his course, and that of the department and that of the faculty and the university. So they could get an idea, you know, about how well he did or she did compared to others, what are the areas of strength and what are the challenges. I hope that answers the questions.
Thank you.
Okay, now to Abdul Rahim. You raised some big issues, so we're going to ask you a big question. Okay. So with regard to, you were talking very much about transformation, and this question is picking up on the comments from several people, including from this morning. So transformation, you know, to get to transformation, we've got a transition time. During that transition, there's which is the social distancing. One colleague raised the question of how, you know, how can we encourage social distancing when it's culturally, you know, it's not something that we're used to. And another kind of question I'd like to raise with regard to that is that we think of good pedagogy as being children working together and interacting, you know, developing critical thinking. So social distancing therefore seems to present two problems, you know, one with regard to culture and one with regard to our idea of a transformative pedagogy. And I just wonder what your thoughts are on that and that kind of bridge that we have to go through before we get to transformation. So big question, but I know you're up to it. So thank you.
Thank you very much. In fact, it's a big question, and it's a big question not only for you but for all of us, and it's challengeable. يعني هو تحدي كبير للأنظمة التعليمية، تحدي لوزارة الصناعات التعليمية، ولو كان عندي أنا جواب على هذا كنت بتكلم عنه. يعني الموضوع أعمق بكثير. هذا أنا بتكلم على أنه لابد أن يكون هناك تغير في السياسة التعليمية، في نظرتنا للسياسة التعليمية، في التعاون والشراكة المجتمعية، في التعاون والتكامل بين المنظمات العاملة في التعليم، ليس في تجميع البيانات ولكن في إيجاد الحلول لمساعدة الدول. هذا كله يحتاج، ما زلنا في مرحلة مبكرة، ما زلنا لحد الآن غير واضح بالنسبة لنا، غير ناضج كيف سيكون، كيف سيبان، مرحليته، آليته، متطلباته. أنا أعتقد هذا هو التحدي الكبير، وهذا يعني اليوم نتكلم على بيديولوجيا جديدة، نتكلم على آليات جديدة. هذه الآليات واضحة تماما، وبالتالي آلياتها وآلياتها هذا الآن نحن في مكتب الخليج سنقوم بعمل ورش عمل نستضيف فيها خبراء من مختلف انحاء العالم، لخبراء من مختلف المنطقه. لدينا اراء الافكار ولدينا، لكن ليست كل الافكار للتطبيق. هناك افكار مثاليه عديده، هناك ناس من يفكرون ايضا بمثاليه. نحن نريد ان نفكر بما هو ممكن تحقيقه وفق الامكانيات المتاحه، وفق التحديات القائمه، ووفق ايضا معطيات المجتمع، ووفق ايضا متطلباته. هذا يعني سؤال كبير وسؤال مفتوح، وانا اثرت السؤال ولم اجد، لانه لا يوجد عندي اجابه. اؤكد مره اخرى لانه نحن في مكتب العمل الخليج بالتعاون مع مجموعه العمل العربي مستعدين نتعاون لعمل قراءات حواريه فكريه حول التحول وماهيته، حول ماذا يمكن ان نفعله، لانه الاكيد ان التعليم لن يكون كما كان، ولكن كيف سيكون هذا هو مطلوب، وهذا هو مطلوب منا جميعا ان نعمل عليه. شكرا.
Thank you very much. A big question and a big answer. Thank you very much. Frost, I think you have a question now for our NRC colleagues.
Okay. Well, first of all, thank you, Camilla and Therese, for shedding light on a very important topic, that is psychosocial support for children going back to school. My question is more with regards to how do we ensure that psychosocial support is being provided to all children, especially when we have to take into account the social distancing aspect.
Thank you, Frost. Allow me to do a step back and cite Abdul Salam saying education will never be the same after COVID-19. Never in this period we realized how essential it is to really have PSS and CEL integrated in education. And we're at a crossroads right here. I was very surprised to find out from the latest No Lost Generation survey carried out with 42 UN, INGOs, or NGOs that PSS and CEL funding was really limited inside education, formal and non-formal settings. So going back to your questions, there is a wealth of guidance that has been developed, and Meline has just presented the cluster guidance that was pulled together for going back to school. And through World Health Organization, I think that what we're talking about is integrated packages for teachers and capacity building that will pull together PSS CEL together with social distancing and best practices and all that goes with best practices in terms of prevention of COVID-19, specifically in settings of refugee camps and in settings where the population is dense. So it's tailoring a package that will be contextualized and useful in each and every setting. Thanks.
Thank you, Camilla. Caroline, you're on mute.
Caroline, you should unmute your microphone, please. Caroline,
we cannot hear you. Let me.
Yes.
Caroline.
Sorry, no, the host muted me. Not me. It just said the host will unmute me. So I'm unmuted now, sorry. Are there any other points that any of the panelists would like to make? Maybe having heard one of their fellow panelists speaking. Any other points that you'd like to make? Is there any other points you'd like to make? Melanie and Emily, first of all, from Save the Children. No specific questions.
I just want to say that I thought in the question someone asked how can we build preventing education system versus a reactive response. So I think, thank you for the people who asked this question, because I think it's a very key question. And I think it's very important for everyone to really try to learn on the situation and on the crisis and try to implement and to improve what we've done. And just to give one example on what we propose on the guide. On the guide, there is a specific technical annexes on protection and education continuity. So we try to propose an exercise with children, parents, and whole school community to ask what did work well, what doesn't work, and to try to create a new plan for education and protection continuity. So the idea is really to try to learn something for this crisis, and how as the other panelists said, the system will not be the same, and it's very important to learn from this crisis. And I think at the level of the ministry, there is also a very important work of crisis and safe planning, and the partners like NGO are also to support ministry in this direction. But yes, just to emphasize the really importance of the preparation and prevention of this kind of crisis.
Thank you very much. Any other panelists like to say anything before we hand back to Dagmara, Dr. Karma, Abdul Ralim, or Camilla? Dr. Karma, we can't hear you. Are you speaking?
No, thank you, nothing.
That's why
I think, I mean,
yes, please. Thank you. Yes, please go ahead.
نعم، أنا أعتقد أنه يعني سؤال مفتوح، وتعاوننا بشكل جمعي. كنا الأسبوع الماضي في لقاء مع مجموعة العمل الدولية حول مستقبل التعليم. أنا أعتقد أن هذا هو السؤال المفتوح للجميع. ما هو مستقبل التعليم؟ ليس فقط على المستوى العربية، ولكن على مستوى العالم. علينا نحن الآن في مرحلة تاريخية من خلالها يعني يرسم العالم نظرة للتعليم 2050. اليونسكو هذا العمل، والأمم المتحدة تقود هذا العمل، المنظمة الدولية تقود هذا العمل. علينا إطلاع الناس بما يجري، وعلينا أخذ الآراء، وأعتقد أن هذا جزء من الحوار، وجزء من الحوار في المنطقة. اليونسكو كان عندها قبل فترة حوار إقليمي. أنا أعتقد أن هذا يثري أن مستقبل التعليم متغير ومتجدد ومتطور، وسنرى نوع جديد من التعليم. شكرا جزيلا.
Thank you very much. So Camila and Therese, any responses? What about the future for education? You talked about the psychosocial role and importance in any model of education. Any other last thoughts you'd like to share, either of you?
No, it was just a question I saw on the question and answer.
Oh, thank you. Yeah, please.
Asking how can we get access to the BOP toolkit?
Okay.
Once we share the presentation, there will be the links, and then we can get in contact with on that.
Okay, so no more thoughts on the future of education then. Are you sure? Thank you, Camila. Therese? Thank you. I think we've had a lot of thoughts on the future of education, Dagmara, and I'll put it back into your capable hands to synthesize and to take us forward. Thank you very much to the panelists.
Yes, thank you. A big thanks to all panelists and to the facilitators. I will not take a lot of time to synthesize, because we'll have Irina to do the synthesis of the whole webinar, and she will address probably also the outcomes of this session. I just want to say two things. There was one question also that we noticed in the question and the chat section about UNESCO's overall role in encouraging or supporting distance learning, including online learning. And I would like to say that those interested can visit UNESCO's website. There are dedicated pages. They will find them very easily. There are dedicated pages to the COVID crisis, to the work of the Global Coalition for Education, and to the school reopening processes. And they find a lot of resources, a lot of information about what UNESCO is doing, and what resources can be accessed and what networks can be accessed. However, now I want to focus on 4 issues that UNESCO is doing. So in some countries, in the context of this partnership UNESCO has with other agencies within the Global Education Coalition, in some countries, especially in Africa, there was direct support given to the ministries based on ministry analysis and needs analysis about infrastructure. So IT infrastructure, electricity supply, and internet supply. So this is one way UNESCO can help countries based on their request and on their needs analysis and feasibility studies to help some countries to really deal with the infrastructure challenge. The second issue is training. We as UNESCO staff, we also got a lot of opportunities to be trained in all these new modalities, because as a lot of you said, nobody was trained, nobody was actually prepared to this crisis. And I just had a conversation with Ellie, who's a great technical support. And we said that we are kind of improvising, because what we are doing with the Zoom platform and other channels, it's more like a professional way of, or would require some professional skills in dealing with audio-visual communication. We would have needed maybe a kind of special room here that is isolated from noises, that has a good background. So we are in a library now, and we could be home actually, but so we are improvising, but we are also learning throughout the process. But training is offered, and UNESCO is offering a lot of training packages for both its internal staff and its external partners. So this should be accessed. Then it's different normative frameworks with regard to distance learning, with regard to online learning, with regard to reopening schools, and this should be also accessed and processed, internalized, discussed with partners. And last but not least, again, not at least, is the monitoring and evaluation process, because a lot of studies are being carried out either by UNESCO or UNESCO and partners, or partners and UNESCO, so that we have an idea about what is going on, what is happening, what are the effective measures, what is effective in all these distance learning business, and especially online learning, but also what are the, let's say, solutions that request less connectivity, like TV or radio, or even kind of distance learning through postal services, or through community services, or other means that countries in a very creative way use. So I think when we talk about the future of education, we have to be aware that while until now we talked about the need of creativity and of creative solutions, this will be the future. I think we need to be very creative, we need to adjust, we need to all learn to do new things, and to also build on what we did before, because it's not to say that the old ways of teaching and learning, or the traditional ways of teaching face-to-face learning, have to be thrown out. And as Karma said in her study, and we saw it in other studies as well, learners really miss a lot in these online modalities and through this distance learning, that face-to-face learning is still bringing about. And we know also the criticism that was attached to traditional learning and to schooling and to so, but schooling has also a lot of meaning, and the structure that it gives to time, to processes, to learning altogether got somehow lost with this COVID crisis. So thank you very much to everybody, and we will try to make it right in broadcasting the video, recording the YouTube, but also the reports of these two meetings, and a list of resources so that people can easily have access to different resources UNESCO and also other agencies make accessible to those interested. So I would now switch to our last session, the concluding session, with our colleague Irina Isomova from UNHCR taking over and offering us first a wrap-up, and then the two regional directors of UNICEF Menaro and UNESCO office in Beirut will say a final word to conclude this very rich and long webinar. But I think it's been worth putting all these people together and giving us a chance to think again, to think anew about all these issues we are now confronted with for more than 4 or 5 months. So Irina, are you with us? Irina?
Thank you.
Yeah, thank you.
Yes, Dagmar, thank you. Good afternoon, colleagues. And as we proceed to a concluding session now, and before I turn to our colleagues from UNICEF and UNESCO for final word, I would like to thank all the presenters and participants for this insightful exchange. In the next few minutes, I will try my best to synthesize today's discussion and the key outcomes that we would hopefully take further as a community of educators. So the webinar provided a space for sharing experiences and policies, practices, and the key considerations for implementing the globally adopted school reopening framework. More importantly, through sharing these experiences, we also had a chance to reflect on the ways of contextualizing and prioritizing our own interventions at the national level. And particularly when it comes to overcoming learning losses and reaching out to the most vulnerable, including children and youth from with disabilities, children and youth from minority groups, as well as children from refugee and forcibly displaced communities. A few specific recommendations could be drawn from the presentations and discussions during this webinar as we reflect on school reopening strategies, the future of education systems, and resources that need to be mobilized. It is obvious that these recommendations could only materialize through a collaborative coordinated action, as was highlighted by many participants. And this action should be amongst different stakeholders. Similar to the diverse group that we have had here today with us, the effort will need to involve various parts of society, humanitarian and development world, decision makers in ministries of education of the states, civil society organizations, academia, for UN agencies. We all have a value to bring on the table. As highlighted by our WHO colleague, Dr. Samhouri, the overall approach remains largely informed by context-specific considerations. In decisions regarding why, when, and how to reopen school, a general situation vis-a-vis infection rates, quarantine measures should be taken into account in the first place. We need to commonly ensure adequate school resources and infrastructure to maintain COVID-19 prevention and control strategies. And policies for educators and staff would need to consider safety of school staff, school environment, especially higher risks school environment, and foresee training for school staff on safe operations, flexible and partial teleschooling. Our colleagues from Ministries of Education of Jordan, Saudi Arabia, and Tunisia reflected on their experiences with education in COVID-19 pandemic, and participants heard about interesting innovative approaches, transformative pedagogy, different system preparedness action, the process of adjusting national strategies informed through the research, as well as ideas and initiatives generated from engagement with local communities, partners, and broader public. We need to continue building on these initiatives and opportunities rendered through these extraordinary times. The international framework and some practical guidance tools, such as practitioner's guide that was presented by colleagues from Save the Children, could equip us better in terms of getting through the practical and sequence steps. So it's important to understand that safety and security implications of school closure and reopening as far as food security at home, capacities and availability of school staff, child protection services in the areas, as well as interventions targeting the most vulnerable are concerned. As it was illustrated through the presentation by Dr. Karma, in the last few months, young people and faculties had a totally different learning experience, and some have not been able to remain fully on track with their classwork for a variety of reasons, varying from connectivity, lack of training, to psychosocial well-being. We need to ensure that all learners have the opportunity to catch up on learning. And as you know, many families have been impacted by the limited to non-existent access to livelihood activities and financial assistance this time. So this is when the inclusive approaches ensuring the safe return to learning for all remain ever so important. It's important to monitor also the effectiveness of measures implemented, and we review and adjust as we proceed with our national and regional frameworks. But as education partners, we committed to follow closely through effects of educational objectives and learning outcomes. Trends in school dropouts after lifting the restrictions and everything constantly remains on our radar. As highlighted in the presentation by our NRC partners, paying attention to psychosocial needs of learners, health as well-being of children, staff, parents, and other community members remains a priority. Finally, as was stressed by our presenters and colleagues from UNESCO and ABEX, the region saw a lot of progress in the past few years in terms of making state system more inclusive and quality driven, in line with the aspirations of SDG 4. However, as Dr. Abdul Salam mentioned, education will never be the same. And the challenge remains ahead of us in sustaining the gains in education and preventing a backslide in gains around access to quality education. So as well as maintaining protective impact of education for the most vulnerable. I believe that through our common effort on keeping and enhancing partnership and collaboration across the sectors, and here it involves really a multitude of sectors, not only education, but also protection, health, and shelters and other sectors. So, but also considering the wealth of experience and the expertise that is vested with the governments and partners, we can address this extraordinary challenge. I would like to thank you, and without further ado, I would like to turn it over to Mr. Ted Chaiban and Dr. Al-Hamami. Thank you.
Thank you very much. Can I check if you can hear me?
Yes.
Yes, very clear.
We can hear you.
Very good. Well, first of all, congratulations on what I think is an excellent webinar, and really thank you for the opportunity to be at the seminar with you, the second seminar on school reopening. It was a pleasure in particular to hear the experiences of Jordan, Saudi Arabia, and Tunisia, and to hear from the different resource persons, both in terms of what's been done to date, but also what we need to think about going forward. I don't know if you've had an opportunity to see our executive director, UNICEF executive director, Henrietta Ford's clip on CNN last month, but she was making a strong case for reopening schools sooner rather than later. And I think this is something we all share as an aspiration, because school closures have really had a profound impact on children in many ways. We heard about the importance of their psychosocial well-being and how that needs to be woven into the work we do. Because also, I think we're all concerned that children may be regressing in their learning, while others may not be coming back if there aren't specific measures taken to reach out to them. But we also have to remember that in many settings, a hot meal that you get at school is a key part of what makes you feel good and stay healthy. That this is where you also identify health concerns and protection concerns. And of course, it's where you socialize. So I think we all recognize that being present, even if in a blended form, is a key part of the learning experience. And I think this is such an important webinar to make sure we are as prepared as possible for that. I recognize at the same time that this is very complex, and I think everything that's been put on the table today just reinforces how complex that is. From the information we got from UNESCO this morning, we learned that half the countries in our region still haven't decided when and how to reopen schools because it is such a complex matter. And yet, I think as we face these concerns and challenges, we also are clear that there are ways to address them, and there are ways to go back towards school reopening. In this regard, I want to kind of focus on 4 issues that have come up during this seminar and emphasize them. I think first is this notion of making sure that children do come back and re-engage with learning. And there's a number of measures. I think some of the concluding speakers in summarizing the session spoke about how this really takes a multi-sectoral effort to move forward. But measures from incentive scheme to families to come back, as well as clear communication strategies with children and parents to address their fears of coming back. I think there's a wide range of measures to make sure that children don't drop out, and focus specifically on the most vulnerable in terms of their risk of dropping out. Second, once children are back, to make sure that they have opportunities for catch-up. This will likely require an adjustment of the program for the coming school year, or maybe better, to try to learn differently and really see this as an opportunity to really reboot how we learn, given that there probably are issues that predate COVID. So really, how can children re-engage in learning where they left off, and making sure that they have that refresher period up front to be able to kind of take off properly. Third, it's interesting that some of the words we all use, the word I use is blended. This notion, and I saw some of the very practical questions that were coming that I think we all need to help think through. So this notion that some of this may be online, some of it may be in situ. What are the budget implications? What are the resource implications? What is the optimal blend given the need for physical spacing, but also not losing contact? I think those are important reflections, tools, benchmarks, guidelines that we'll need to work on together. And then I think an important point, if I had a Jordanian dinar for every parent who told me how much they now appreciate the role of teachers, I'd be a rich person, because I think everyone recognizes the key role of teachers, including in this blended learning, including on digital learning. So really taking every step so that teachers are not left behind. How can they deal with the COVID-19 challenges and be supported to do so? How can they be at the center of any education transformation, whether technology is used or not? If we're going to be successful at this next phase, they need to be engaged along with parents and students and peers to move forward. So I think as education stakeholders, we'll need to find ways to address these issues while building the resilience of education systems through mechanisms that are manageable, affordable, and sustainable. I think during the session today, a number of organizations referred to tools they were working on. So we heard about the work being done under the umbrella of the Global Coalition, led by UNESCO to support education systems moving forward. Several organizations are working on that. We heard about the guidelines produced by Save the Children, as well as UNICEF's teacher preparedness training package, targeting teachers directly to make sure they are prepared for the challenges of COVID-19. These resources should be available in a timely manner for countries to be supported and for teachers, students, and parents to be supported. But one thing you can rest assured is that as partners, we are here to support and think about the best options available in the coming months so that school can open safely and better than they were before. Please count on us, and congratulations again. Take care.
Thank you very much, Ted. And let me also join you to congratulate all of us for the success of this webinar. Say all the people who have participated in this webinar, we need to assure them, we as a UN, we are going to continue to work as one UN. And I think this is one of the second webinar that we are trying to do together. And I think there will be an important that I'm thinking while we are here and I'm listening to the colleagues and as well as the member state. I think it's very important now to think about an annual program that is the regional directors or the regional offices to do together with member states. So congratulations. And let me start by going back to some of the issues discussed. And one of them is about rethinking education. Education is not going to be the same after COVID. And this is where we talked several times, even with the ministers and with the policy and decision takers, about what do we need from education after COVID. And this is very important. There will be specificity for each country, and there will be also generality for different education system. And then when we decide what we need from the education system, we need also to think about how. And just Ted and other colleagues, they told about the blended system, whether we're going to use online, etc., etc. And here I think we need to talk about the second step, and that is a tashri', which is policy. We need to take policy and decision at each country, which also can reflect at the international level. And also in 2018, UNESCO and the member state, they rectified the Convention for Higher Education. And I hope COVID was before that, so we can add the online education, how we also to contribute to education and also to be recognized. Until now, we are using the online education, but most of the country, if not all, they are not recognizing online certificates. And this is another problem that the member states and the world community, they need to think about this. The second issue is regarding the societies and the education and the teachers. We are going back to schools. We need to prepare these people. Just talk about the preparedness for teachers, but also we need to prepare the parents about from moving the children from the house until the school. How do they behave with them? What kind of behavior we need from the students and the teachers, how to deal with the students, not only educational wise, but also during the interaction with the students. These are very important. And then we talk about also how can we train them pre-service and in-service training according to what is needed during this period. So the preparedness of the society, the preparedness of teachers is very important for this period. I don't want to go more, but also a point raised about the psychosocial, which is very important. Our students, our teachers, the parents, all they have gone in a very tense, psychological situation. I think very important member states now to realize that they need to have a program at least once a week for psychosocial support inside the schools. So without taking more, I think I would like to close by thanking all of you for participating as member states in this webinar. I would like also to thank our colleagues, our regional director, especially Ted, for facilitating and cooperating in this issue. And we need to do more about that. Special thanks for the colleagues who have prepared for this webinar, from UNICEF, Janet, and from WFP, from HCR, from the World Bank, UNRWA, Save the Children, and RC. All these colleagues, I think, all the work that it has been done, it is very much appreciated. From our UNESCO headquarters, also special thanks to Juan Chang and also our colleague Burhan for also joining us from headquarters Paris. And then I would like to thank the experts and the presenters who have presented and joined the discussion with great thanks. I would like to thank our NETCAM, National Commission for UNESCO, and the Ministry of Education for also being patient with us, also for participating, for delivering the invitation, and for joining all these efforts. My thanks also goes to my colleagues in the region, the UNESCO offices, for also participating, for keeping according to what is needed from member states. And I do encourage them also to start talking, including other UN agencies, to start talking to member states what is needed according to the discussion. From my office, I would like to thank also our Chief of Section, Hana, Dakmara, Maysoon, Ili, Dr. Hijazi, and all colleagues, Lilian, and the IT team from my office, Yahoo, have helped to do this this webinar successfully. Also, special thanks to our interpreter for taking the burden to interpret during this session. So thank you for you all, and we're looking forward for another webinar, for another meeting, inshallah, and wish those colleagues who are going to take summer break all the best and successful. Take care and keep safe. Thank you very much.
If you can unmute me. Yes, thank you, Dr. Hamed. Thank you, Ted and colleagues. We are now closing. Just one word, there was a series of questions about certificates. We will investigate, we will try to see how to do that, because we can keep a record of the participants who were in the webinar, and I will consult with our partners, with the other agencies, to see how we can do that. Maybe we will open up a link to provide a generic certification for these webinars, and we will get back to you. So all unanswered questions we will also consider with regard to getting back to those who asked them. And sorry, we could not address all the issues, and we could also not maybe give all the answers that were expected. But as said, this will help us progress and will help us keep going with all this reflection and self-reflection that is so important in finding solutions. So a big shukran to everybody, and hope you're not too tired. So think of the nice music when you go home that Ellie found for us to relax a little bit. And we'll get back to you with the recording of this webinar and with additional materials that document these two webinars since May 2020. So as Dr. also Hamed said, those who go to holiday have a safe and relaxing holiday, and those who keep working, keep up with the good work. So thank you very much, and see you, stay safe. Goodbye.
Thank you. Bye.
Bye. Bye.
Bye.
Bye, Dr. Mara.